assigned to your channels.
Hi, good morning, good afternoon, good evening, everyone. Welcome to day one of the 2025 Global Nutrition Cluster event. My name is Megan Gayford. I'm the co-chair of the GNC program team and also a nutrition specialist at UNICEF. I am very happy to be co-moderating today alongside Kate Golden from Concern, who is also a GNC SAG member. We will have some housekeeping in a moment, but before I do encourage everyone to have a quick look at the chat to see interpretation instructions. So this session is available in French, Spanish, and Arabic via the global icon on Zoom. Okay, so this year's global event is structured around 3 core objectives that guide everything we'll do over the next 3 days. So I'd like to take a minute to take us through those, so make sure that we all have a shared understanding of what will be happening over the next couple of days. Actually, could you go 2 more slides, please, Ben, to the core objectives? Yes, okay, thank you. Okay, so the first objective is around reflecting on our progress. So over the last strategic period, we have as a community faced really significant challenges, and those challenges are feeling particularly burdensome this year. But this week, we'll be hearing directly from country teams, from working groups, from partners about what has worked, where gaps remain, and what we've learned along the way. This is a really important moment for reflection, not just on the outcomes of the work that we've been doing, but how we've worked together and how our system has evolved. The second objective is around communicating all the things that we've been doing, so new guidance. One of the most exciting parts of this week is the opportunity to showcase the technical progress that's been made across the GNC partners. From updated guidance and tools to learning to field research, we'll help updates on innovations in nutrition information systems, early childhood development, cash and voucher assistance, and many more topics. This isn't just about sharing knowledge, it's about sparking dialogue on how we implement, how we scale, and how we adapt in different emergency contexts, in particular the context we're facing this year. The third and final objective is about shaping the next GNC strategy. So this event is a really important moment in the collective process to shape our next strategy. What does the future of nutrition and emergencies look like? How do we recenter our work around people, around equity and local leadership? And what are the system-wide shifts we need to embrace? And how can we as a GNC support them? These aren't easy questions, but they are really essential ones. So throughout the event, you'll have chances to contribute to shaping our vision and the priorities for the years ahead, and particularly in the strategy session on day 3. Okay, so can we just go back a couple of slides? Thanks, Ben. So just to let you know what to expect in terms of today, after our opening remarks, we'll begin with a scene-setting session that explores the global humanitarian landscape and what it means for nutrition and emergencies. From there, we'll move into the first set of sessions aligned with a people objective of the GNC strategy, starting with an operations update and followed by 3 breakout options. We'll talk you through these as we get closer to the time. After a short break, we'll shift to the operational and technical support objective. We'll hear updates from the GNC working groups. I know many of you are part of these working groups, explore innovations in early child development, and close the day with a panel on cash and voucher assistance for nutrition. We'll have a short wrap up and set the scene for tomorrow. Okay, that is I will be moving on to the opening remarks now. Next slide, please. Okay, so I'd really very happy to introduce Hazel DeWet, the Deputy Director of the Office of Emergency Programs at UNICEF. Ms. Hazel is the Deputy Director of the Office of Emergency Programs of UNICEF. She's based in Geneva, a position she's held since January 2023. Hazel has 23 years of experience in political affairs, in human rights, protection of civilians, women's rights, and international relations, also in diplomacy at the UN. She is a former diplomat. Hazel's experience spans across a wide spectrum, from working with local actors to policy making, high level political engagement, and intergovernmental processes at the UNHQs. Okay, I would like to invite Hazel.
Hi, good afternoon, Megan. As you've indicated, I've been around a little long in life. And for me, it's a real honor to be here today with all of you again. I think this is the second time that I am having the opportunity to address all of you. Um, this year comes as in the environment where we currently are, we clearly see that this is a difference in the way that we've been operating currently. I'm really pleased that you have the opportunity to come together, representing the country level coordination teams, the SAG members and partners, the GNC global level members and partners, as well as the global teams. This is for me a demonstration of all of our collective efforts and commitment to ensure that we can deliver as required to all of those most in need. I also want to acknowledge and really thank our donors on this call, I believe. We clearly would not be able to provide the support for nutrition during emergencies if you weren't part of that steadfast commitment and dedication, allowing us to deliver the much required assistance. I would also like to basically say, as much as you have the opportunity to come collectively, albeit virtually, it is important that we look at how we go about our coordination. And equally, as the global cluster lead is able to respond to nutrition in emergencies. We all know, understand, and agree that effective coordination is the backbone of any successful nutritional and emergency responses. We all would want to know what the predictability is about, how we go about our responding to the needs, whether it is due to conflict, natural disasters, or other disease outbreaks. We clearly have seen that there are multiple actors that continuously come together. And therefore, without coordination, this can lead to lots of forms of duplication of efforts. And in some areas, it can also mean that there could be lack of providing critical response to gaps in other areas. So what we do and how we go about our response in providing the response to the most vulnerable population, coordination is a cardinal requirement in the way that we go forward. However, this we are gathering in a world where the entire humanitarian community is going through a significant review, reassessment, reset because of the drastic funding cuts. But it is not only the funding cuts that we are having to look at. We're also having to look at, and we're required to have a review and a reassessment about what is it that we do and how we collaborate. So my message to here today is that we cannot continue to operate the way that we have been doing the past 20 years. There is a clear outcry from all concerned, be it beneficiaries, be it member states, be it the donor community, be it other partners, that we do look at how best to simplify our processes, to review what has been done. UNICEF, alongside with Save the Children, has been leading a cluster simplification process that want to look at the efficiencies. And our Deputy Executive Director, Ted Chaiban, alongside with Gabriella from Save the Children has been looking at. And I'd like to leave you with a couple of messages that I've experienced having been part of this reset exercise. One, and this has to be part, and I hope that this will be part over the next 3 days. There's a strong feeling and belief that the cluster system, in and of itself, has become about the clusters, as about how we are supposed to respond, and that there is a need for us to review our approaches, to review our structures, and to make sure that we become more agile, more efficient, and therefore closer to responding to what people need. I've also been provided with the message that the cluster system has become about itself in the way that it looks at heavy overarching processes and less about the actual response. So I would really appreciate if all of us could look at how best we can review our processes so that we are less bureaucratic in nature. I would also like for all of us to seriously consider, are we operating as close to those who we are supposed to respond to or not? And I'd also like for you, with this time that you have, because there's a strong emphasis on localization and ensuring that our partners are not mere numbers, but that they are actually key functioning decision makings in the way that we operate, and that localization is critical. There's a strong push tomorrow. The interagency standing committee and principals will come together, where the principals will be looking at the 10-point plan provided by the ERC, and that they will be taking decisions that will have impact in the way that we operate. So my final messaging to all of you is not to merely accept where you've been to date, but to see what processes and programs we can collectively undertake so that we can become far more efficient, because we are having drastic funding cuts. I've been explaining to everyone, UNICEF is undertaking very significant revisions, reassessment in the way that we are regionally structured, headquarters-based structured, and looking to see how best can we all ensure that despite the drastic and critical changes that our organizations, both individually and collectively, are undertaking, but that we are taking it in a manner to ensure greater efficiencies so that we can advance the lessons, the experiences, the principles of the past 20, 25 years, despite the fact that we need to review the way we operate. So I'd really like to leave this for you as a message clearly for UNICEF. The nutrition as the cluster lead agency remains an important contribution, and we really want to ensure that as a cluster lead agency, we will make sure that we keep the promises that we are about to make in terms of the commitment to respond to people's need, but we also ensure that we review our current operating modus operandi so that we can reflect the change that everyone is requesting of us, but we can also ensure that we are much closer to where we're supposed to be, and that is responding to the people and less structured and bureaucratic, because that is not what I am saying. That is what everyone else is telling us about us. And I think it's critically important that we hear, we listen, we review, we assess, and see how best we can go forward. I wish you all the best over the next 3 years. It's a very, over the next 5 days, I believe, over the next 5 days, doing this in a virtual setting. But I know that I work and have the opportunity to and be able to provide the assistance. Our requirements are not going to become less, and regretfully, we will have to see how best we can respond to the needs of the people in this very changing world of ours. So the best. It's good to see my colleague Abdurrahman. All the best. And Anu, back to you, Megan. Thanks a lot.
Okay, thanks so much, Hazel. And some of Hazel's points we will be picking up in the scene setting session by Stefano. Thanks so much, Hazel, for your comprehensive remarks. Okay, I would now like to introduce Abdurrahman Sharif, who's the Senior Humanitarian Director at Save the Children, where he leads the organization's global humanitarian strategy and preparedness. He has held senior roles across government, NGOs, and international organizations, including as a special advisor to the Somali Prime Minister and with Internews Europe, the Somalia NGO Consortium, and the Muslim Charities Forum. Abdurrahman, over to you.
Thank you so much, and thank you, Hazel, for your wonderful introduction. Obviously, as Hazel has mentioned, we're facing difficult challenges ahead of us, and as we face record levels of child malnutrition across humanitarian contexts, we must ask ourselves: are we responding in a way that saves lives today and builds stronger systems for tomorrow? I think this meeting comes at a timely moment as the global nutrition structure looks at the strategy in 2026 onwards and shaped in line with what is happening around the humanitarian reset. Right now, we're too often seeing parallel response systems, emergency programs on one side, long-term health and nutrition systems on the other, that can lead to duplication, gaps, and missed opportunities. We can't afford that anymore, and the Global Nutrition Cluster over the years has been a great example of how, through strong coordination and technical leadership, governments have been supported to lead, coordinate, and ensure responses are appropriate in their countries. Save the Children are incredibly proud to have co-led the Global Nutrition Cluster program team over the last 2 years and continuing that role until the end of our rotation. And we have obviously 3 messages that I'd like to share today as you lead on this the strategic overview of the Global Nutrition Cluster. Is first that we must continue to prioritize government leadership. When national authorities, particularly ministries of health, are supported to co-lead coordination platforms, even in the most fragile settings, responses become more joined up, locally owned and sustainable. We've seen that in places like DRC, where community-based models are now being scaled through government systems. This style of leadership is the direction we need. Second, we must act across all the full continuum of care. Malnutrition doesn't start at the clinic, it starts at home, often silently. So our responses must include prevention, early detection and treatment, as well as links to broader supports, things like maternal health, safe water, feeding practices, and social protection. Emergency treatment on its own isn't enough. We need to strengthen the foundations. And third, we need predictable, flexible, long-term financing. 6-month humanitarian grants don't support long-term planning or the kind of integrated services children need. We need donors to champion pooled and adaptable funding streams that bridge humanitarian and development mandates. It's time also for that financing to have financing that reflects the realities children face. And finally, it's important also not to forget community delivery systems, particularly community health workers and local organizations. These are the frontline actors that can sustain care between crises. They must be supported, trained, and fairly funded. Let me maybe conclude by sincerely thanking our colleagues at UNICEF for their continued leadership of the Global Nutrition Cluster. Your commitment has helped us shape a stronger, more coordinated global nutrition response as we enter a new phase through the humanitarian reset and the overall reduction in funding. Save the Children is still committed to continued partnership and program team co-leadership with UNICEF, with national governments, and with you all here to ensure that nutrition remains at the heart of humanitarian action and long-term recovery. Thank you.
Thank you so much, Abdurrahman. And now for our final speaker this morning, Anu Narayan is a senior advisor for child nutrition and development in humanitarian action at UNICEF HQ. She supports UNICEF's global advocacy, program delivery, and partnerships related to nutrition and emergencies. Previously, she was the Chief of Child Health and Development at UNICEF China and has also worked with US NGOs like Save the Children and Helen Keller International. Over to you, Anu.
I think I've been unmuted. Can you hear me now?
Yes.
Okay, perfect. Well, thank you, Megan, for giving me the opportunity to speak as well with Hazel and Sharif. And good morning and good afternoon, colleagues. I'm really delighted to represent UNICEF's program division of child nutrition and development, and to also recommit our ongoing and strong engagement and the role that we play with in the global nutrition cluster. As we just heard from the previous two speakers, I mean, we cannot deny that these are challenging, difficult times of very rapid change as well. And speaking as a practitioner myself, along with all of you, I think it's sometimes has been very heartbreaking to see the programs and services that we have really tended and built over these many years being forced to often being scaled back or reduce services or coverage, and the uncertainty that has created in the communities and the real impact that this has been having on the families and the children that we really care about as a community. But I also think this is a chance for us to sort of rethink and understand the journey that we have already made as a community. I think the nutrition and emergency sector has a really strong history of positive and passionate action. We have actually built a global program over the last 25 years, really innovating in how we deliver programs, but also really changing the way of collaboration and building partnerships and networks in that process. And, and we should feel proud that the Nutrition Collective and the GNC's work is often held up as one of the most active, collaborative, data-driven clusters that do exist at the moment. So while Hazel and Abdurrahman have laid out some of the key challenges and the changes that we need to make, both in terms of processes and program strategy, I think we should take this time to exercise those muscles that we've had and built over the last 25 years to reconsider how and where we work, what tools and strategies we need to sort of bring to address the new challenges that we see now, and understand that in a vastly reduced financial environment, which has really impacted the talented national workforce that we have sort of committed to building and have been working with, what are the changes that we need to make, including understanding that there are significant levels of conflict that are vastly reducing the access to services that we are wanting to provide. So I'm hoping that over the next few days, we will use the opportunity to identify these challenges, we'll exchange ideas, find some solutions, and then continue to be sort of creative and collaborative in the process to find these solutions. And I know that the Global Nutrition Cluster really offers an important platform to do this. And I encourage all of us to sort of participate and engage in that. Over to you, Megan. Thanks.
Thanks, Anu. It's me.
Oh, hi. Sorry.
I'm the other co-facilitator. I'm Kate Golden from Concern, and I'm just going to hand immediately over to Shayna, who from JSI, who's behind the scenes, and she's going to give us an update on housekeeping for the rest of the session. Shayna?
Thank you so much, Kate. And yes, I'm just going to go quickly over some housekeeping guidelines. First and foremost is to just talk about how to access interpretation. As we mentioned in the chat, interpretation is available live this week in French, Spanish, and Arabic. If you would like to use the interpretation, you can click on the icon, which you can see on the slide is that little globe icon on the bottom of your screen. This example is a different example. We don't have German, unfortunately, but you should see the options for English, Spanish, French, and Arabic. You'll click on it and then select your desired language. And then we highly recommend that you select mute original audio, which I think on the next slide you can see. So yes, you'll see that option to mute original audio. So that way you won't be hearing what people are speaking in the background, which can be distracting. And if you are listening in English, we still encourage you to select English because there will be times where speakers are presenting in other languages. Presenters, we do ask you to please remember that you are being interpreted, so please speak slowly and clearly so that the interpreters can follow along while you are presenting. Closed captions are also available. If you would like to view them, you can click on the CC icon at the bottom of your screen and select Show Captions and choose your language. Please note that these are auto-generated captions. There are 6 of us from the JSI team who will be supporting you this week. Ben, who is sharing the slides for us and doing a lot of help with the presenting. And then you will have Tamar, Kaylee, Julia, Sarah, and myself. We all have JSI and tech support in our Zoom names, and we are here to support with Zoom logistics, interpretation, recording notes, and some of the interactive elements. If you do need help with anything, including how to access interpretation, please, again, search for the tech support in the attendees or participants box and reach out to any one of us, and we'll be happy to help you. We will be using, again, the chat to ask for help, as I said, or interact with other people. Many of you have already introduced yourselves. It's wonderful to see that. So please keep introducing yourself if you haven't already and interacting in the chat. We do ask that unless you are presenting, please stay on mute and off camera. There will be some options during the Q&A and in breakout sessions for you to be more interactive with each other. But while we are in this main session, please do stay on mute and off camera. We will be using the Q&A box during the question and answer times. I think most sessions will have a question and answer period. And yes, we'll be using the Q&A box. And that will be the best way for you to make sure that your questions are seen and answered. They may get lost in the chat because the chat moves very quickly. I think that is all. Oh, we are recording this all 3 days. So if you are unable to come to one of the days or some of the sessions, or if there are people here who are not able to attend, we will be sharing the recording out later after this event. So thank you all.
Thank you, Shayna. So as I said, I am Kate Golden, and I am talking to you from Nairobi, but I'm normally based in Ireland. And I'm here to introduce the next session, session 1, which will give you an overview of the global nutrition landscape, carrying on from our first introductory remarks. And that will be by Stefano Fedele, our Global Nutrition Cluster Coordinator. And then we will have Nana Yohari, who is the Sun Civil Society Network Youth Leader, who's hosted by Save the Children. So just to give you a little background on both before Stefano launches in. Stefano has been the Global Nutrition Cluster Coordinator for over 4 years. Prior to that, he was Regional Nutrition Specialist for UNICEF's Regional Office for Latin America and the Caribbean. He was also Nutrition Cluster Coordinator in Haiti following the earthquake of 2010. And he's worked in various emergency operations in Asia and Africa with UNICEF, WFP, and UNHCR. And Nana Yohari is a nutrition and health rights activist from the Democratic Republic of Congo. She works to strengthen food systems in her community by encouraging people to adopt healthy eating habits, promoting good traditional practices, and advocating for improved lifestyles and access to water. Nana is in her 6th-year she's a 6th-year medical student in DRC at the Université Catholique de Bukavu in South Kivu province, where she's learning additional skills to help her community overcome health-related challenges and improve access to healthcare. So Stefano, I'm going to hand right over to you. Oh, I should probably say, Stefano, you are presenting in English, I believe. And Nana will present in French. So get your interpretation button sorted before Nana starts. Over to you, Stefano.
Thank you very much, Kate. Good morning, afternoon, everyone, and thank you for joining us today. First of all, I would like to share my particular appreciation and thoughts to the many among us who are actively participating in this event while undergoing major changes in their organizations, capacity and structure, which affects their capacity to reach the millions of people in need, and also perhaps their own, these conditions perhaps are also affecting their own job security and the well-being of their families. So very much appreciated your contribution. Now, I would like to take the next 10 minutes to reflect on something that unites us all. This is regardless of where we come from or what we do, our shared responsibility to protect and respond to the most vulnerable people affected by nutrition emergencies and how this is affected by the current global humanitarian landscape. What it looks like now, the challenges we face, and the path forward. Next slide. Okay, sorry. So, as our colleagues have clearly indicated a few minutes ago, the global humanitarian landscape is evolving rapidly and the needs are intensifying. Yet, among all these challenges, we should not lose hope. And we need to recognize progress where it is available and where it takes place. The humanitarian reset is a direct response to this crisis, and it's forcing all of us to rethink how we coordinate, who we empower, and what we prioritize. One of the most promising shifts in the humanitarian landscape is the strategic shift towards stronger localization, giving more power, funding, and decision-making authority to local actors and national governments. People who understand their communities, cultures, and contexts better than anyone else. This is also a large part of the humanitarian reset and is a pillar of the next GNC strategy. And also, I would like to say that the GNC has had the localization as a top priority already for several years, not just in response to the more recent changes. Now, just a second. In parallel and in response to the humanitarian landscape, there is the humanitarian reset. Now, this is articulated by the Emergency Relief Coordinator, ERC, and it calls for a fundamental shift in humanitarian support, one that re-centers the system on people and enables more locally led, anticipatory, gender-sensitive, and collaborative actions. Clusters remain needed, but they must evolve to better support national systems, connect with the local actors, and support collective outcomes, and align with broader approaches such as the Nexus programming and area-based coordination. Next slide. So, a set of tangible and bold recommendations have been put forward under the humanitarian reset. These are not only theoretical, they are already shaping humanitarian action, including how the GNC operates and advocates, and will underpin our next GNC strategy, which is currently under development. These recommendations will be officially shared with the reset package that is expected to be formally launched this week. Ahead of the formal launch of the reset, I would like to take this opportunity to highlight some key priority shifts that are relevant for the Global Nutrition Cluster and our partners. First of all, there is a shift to a more flexible country-led coordination, where humanitarian coordinators and humanitarian country teams are now able to better tailor coordination setups based on the specific context, challenges and opportunities. This includes deciding whether to activate clusters like nutrition or to merge or adapt based on needs and local capacity. This flexibility can be empowering, but also requires vigilance to ensure essential needs aren't deprioritized or missed. And we know that in the past, the nutrition cluster, the global, regional, and country level had to really intervene to make sure that nutrition-specific needs will be recognized and supported. A proposal is underway to simplify clusters and reduce the number of global clusters from 11 to 8, and this includes mergers across shelter, logistics, and protection. We have strongly advocated for the GNC to remain as a standalone cluster while collaborating very closely with other clusters, and in particular the health, wash, and food security. Now, this strong advocacy was needed and thankfully successful because there has been no concrete evidence or solid examples that merging nutrition with another cluster has been successful in improving the efficiency and effectiveness of nutrition action. Any past attempt to merge nutrition have led to weakened coordination and diminished visibility for nutrition, which had a direct impact and effect on the population in need. Nutrition interventions, particularly those addressing severe acute malnutrition, are life-saving, and merging could potentially make it more challenging to advocate for nutrition-specific funding, programming, and policy, particularly given the competitive nature of the funding landscape. Specialized nutrition expertise could also be diluted or lost in a merged situation. The GNC Strategic Advisory Group and other key partners and donors have also expressed strong support for nutrition to remain a standalone cluster. And as I said earlier on, obviously, while this specificity is welcome and strongly needed, it's very important that nutrition works very much cross-sectorally to ensure better convergence of effort and greater impact as well of the very limited resources we're going to be having. The humanitarian reset also calls for greater support of area-based coordination at the subnational level, with national leadership, national and also subnational leadership co-shared, ideally with local and national authorities, or where that is not possible with other actors. The GNC has been a step ahead with the development of the localization roadmap, and moving forward, we need to support local partners to take up greater leadership roles and advocate for greater allocation of resources, spaces, and support to lead. Now, also the nutrition cluster has historically being one of the clusters that's better been able to co-lead or lead or support the national authorities lead in nutrition, and in almost every country that we work in for already many years. So that is something that we are, as a cluster, we are better prepared than others perhaps to push forward. With limited funds, humanitarian operations are being forced to hyper-prioritized. For nutrition, this means fewer people reached, fewer programs funded, and hard decisions about where and how to intervene, and also to ensure that we have, as I mentioned, the multi-sectoral convergence of efforts maximized to achieve a greater, longer-lasting impact. Our role must be to advocate fiercely for nutrition life-saving relevance in those priority discussions, and ensure that the nutrition cluster is activated as early as possible in a new or rapidly deteriorating crisis. The humanitarian reset demands that we plan for transition from the start. As we know, clusters are not meant to be permanent, and with cluster activation, there must be clear plans outlined for handover to national systems and sectors. This requires early investment in government partnership, capacity strengthening, and joint planning, not just at the end of a humanitarian response. Again, here the nutrition cluster has a long history of strengthening national capacity whenever possible. Myself, I also conducted a very successful handover of the nutrition cluster to structure, because the leadership already was with the Haiti national authorities after the earthquake, and many other in many other contexts we have important lessons learned on how this accompanying can be more effective and efficient. So next slide. What does it mean for us at the GNC? All these changes really mean leaning into the reset, not resisting it. It means embracing simplification where it makes us stronger and faster, but also pushing back where our core functions are at risk, like weakening nutrition coordination. It means aligning with localization, not as a widely used slogan at the moment, but through promoting local and national leadership, supplying direct support, and power sharing with national actors. This also means continuing to make the case that nutrition is life-saving, that coordination is essential, and that the GNC remains a vital part of an evolving humanitarian architecture. To close, I want to thank you all for your continued engagement. These challenges before us are significant, but so is our capacity to act. And the nutrition cluster has shown very effective flexibility in changing our approach and our support of national effort. So these changes offer us a real opportunity to rethink, adapt, and improve the ways we support and really support the people that we serve, but also support each other to make sure that our response continues to be a model of excellence in efficiency and efficacy. So thank you very much, and back to you, Kate and Megan. Over.
Thanks so much, Stefano, for that overview. I'm going to hand swiftly on to Nana. Nana, I hope I'm pronouncing your name correctly. Are you with us? I saw you there a minute ago. And maybe we can move on to the next slide. The next, there. So Nana Yohari, over to you.
Bonjour à tous. Est-ce que vous parvenez à m'écouter?
Oui.
Okay. Bonjour à tous et bon après-midi. Je tiens à remercier Global Nutrition Cluster pour l'occasion de pouvoir parler au nom de la jeunesse. Je suis Nana Yohari, je suis la coordonnatrice nationale des jeunes leaders pour la nutrition en République démocratique du Congo, qui est une plateforme de la société civile de STEM, donc Save the Children, et qui plaide en faveur de l'alimentation. Et en particulier, nous œuvrons au travers des campagnes d'écoute. Et nous sommes actuellement plus actifs au niveau du Sud Kivu à Bukavu. Alors, actuellement, les nord et le Sud Kivu de la République démocratique du Congo sont sièges de nombreuses insécurités ainsi que de conflits, donc des violences armées, qui ont recommencé encore avec puissance ces derniers mois. Alors, cette situation se répète malheureusement au niveau de la population, en particulier aussi en ce qui concerne l'accès aux denrées alimentaires. La majorité des denrées alimentaires que nous avons ici au Sud Kivu viennent pour la plupart des pays voisins, ou soit d'agriculteurs locaux qui vivent en périphérie de la ville. Depuis le début de cette crise, le prix des aliments sur le marché, contrairement à ce qu'on aurait pu s'imaginer, ont plutôt baissé.
Nana,
Du fait
Nana,
oui.
excusez-moi. C'est possible de parler plus fort ou presque de le mic un peu? Merci.
D'accord.
T'approchez au microphone, s'il vous plaît.
Ok, merci. Est-ce que là, c'est mieux?
Oui, oui, merci.
D'accord. Alors, je disais que la situation actuelle d'insécurité a fait en sorte que les prix des denrées alimentaires
led to the price of food on the market in DRC, in Bukavu especially, reduced, contrary to what we thought, and is based to the fact that the majority of the animals sold come from neighboring countries or from agricultures, farmers living around. Was imposed for local farmers around. There was more restrictions to protect farmers in the country, so local producers are not as sorry, could she speak a bit slower?
Eu à faire une campagne de course lors du mois de mai dernier auprès d'une école secondaire, Humanitarian, où nous avons eu à discuter des différents défis que rencontrent les élèves au sein de leur foyer pour pouvoir accéder à une alimentation saine et équilibrée. Et certains défis ont été relevés. Durant la période des crises, il y a eu énormément de des pillages qui ont été faits et des déplacements de population. Cela fait en sorte que la population aussi qui est en grande partie une population qui vit
The population
comme activité de base.
they rely on trade. Many families didn't have any fun. That's why they were not able to have the same livelihoods to.
Excusez-moi. Un peu lentement, plus lentement. L'interpréteur a un problème avec le très vite.
Ok. À part cela, il y a aussi le foyer des ménages qui étaient au départ
some household,
militaires. Malheureusement, ces militaires-là ont eu
military's household,
la vie du fait de l'insécurité en laissant derrière eux des
because of insecurity, they left.
Qui ne savent pas comment subvenir à
They,
leurs besoins.
they didn't know how to. Those families were removed from their house, and it was linked to the activity of their parents who were in the army. So we have families that do not have any means to live, and they used to have support from churches, and they're helping them. Apart from that, some warehouse were victim of attacks because of insecurity. Families that receive humanitarian help do not have access anymore to the help that they received. But there's also, I cannot hear her anymore. I don't know if it's me. Okay. They are not able to reach their target. There's a number of hospitals that do not have enough supplies. Apart from that, there are other issues that are not linked directly to insecurity. The lack of knowledge in terms of nutrition and feeding led us to meet people in schools and teach them how to better eat, how we can have a balanced diet by diversifying local food, and to make sure that everybody has access within our community. And to conclude, I would like to talk about the recommendation that we would like to share with the various institutions here to support the activities of local producers, farmers, making sure that the taxes are not are in favor of local farmers. There's to be a way to help to store food, but also important to value local food and make sure that everybody has learn how to have a proper diet that is balanced. And it's important to reestablish the assistance to NGOs that will be able to help in that matter. Thank you very much for your attention.
Merci, Nana. Please, if you have any questions for Stefano or for Nana, you can put them into the Q&A function there. You should see a button at the bottom of the screen. We're a little behind time, so I don't see any questions in there at the moment. So, but you can continue to put them in, and Stefano and Nana can respond to them as we move forward. So I think it's time to introduce our first breakout session. There we go. So we have 3 options, and our JSI team will be able to, send you to these. So we have a lightning talk by Claire Bossard, Beyond Survival, Integrating Psychosocial Stimulation into Nutrition Programs in Emergency Settings. Or you can go for option 2, which is a networking session with colleagues. Or option 3 is just go get a coffee and come back in 10 minutes. So Claire will be here. If you want to do a network session, go for it. Over to you, Claire, or you can just go for a coffee and join us again in 10 minutes. Over to you, Claire.
Thank you. Just waiting for my presentation.
Next slide, please, Ben.
So thank you very much for this opportunity for me presenting today on behalf of the study team, the teams working on the field, as well as our partner, this presentation on psychosocial stimulation, and in particular the integration into a nutrition program. I'm an epidemiologist working for MSF, Médecins Sans Frontières, or more in particular Epicentre. Next slide. Thank you. So if you are a parent or if you've ever cared for a young child, you know how challenging it can sometimes be. And this is even more true when a child is sick. For mothers of children with severe acute malnutrition, this situation is particularly difficult, as severe acute malnutrition affects a child's brain, body, and behavior. You can stay on the same slide. Yeah, next slide. Severely malnourished children can be more apathetic and have reduced responsiveness. They can also be more irritable and cry more frequently, have disrupted sleep pattern, reduced appetite, or difficulty feeding. This was the reality we observed in Koutiala, Mali, where primary caregivers, which are often the mothers, were facing overwhelming burdens. The main important barriers to childcare practices observed during this intervention were a high workload, limited decision-making power within the household, financial hardship, and low levels of education. We also know from literature that severe acute malnutrition is closely linked to poor maternal mental health. Mothers of sad children are more likely to experience depression and anxiety, which in turn affects their ability to care for their child, creating a difficult and often invisible cycle. In this context, how can MSF contribute to improving psychosocial approach to child malnutrition in settings like Koutiala or other emergency contexts? Next slide, please. But before we jump into the topic, what are the fundamentals of psychosocial stimulation? So as you can see on the left of the slide, the diagram shows that it involves the mother or the primary caregiver providing physical stimulation through sensory input, positive emotions, as well as positive parenting, which altogether creates the feeling of inner security, warmth, and affection that the child needs to grow and develop well. It has been demonstrated to have both short and long-term benefits for the child cognitive and social development, and it is recommended in addition to the medical treatment of severe acute malnutrition. Psychosocial stimulation is recommended in the SAM treatment protocol in Mali since 2017. However, strategies and intervention were not yet standardized and few resources have been allocated. For those reasons, we conducted STEAMNUT, a mixed method study to assess the feasibility and acceptability of integrating a psychosocial stimulation intervention into the nutrition program in Kutiala. The psychosocial stimulation intervention consisted of 5 sessions tailor-made for families and children with severe acute malnutrition. You can see the different sessions on the right of the screen. And the curricula was based on the FUSAM protocol developed by Action contre la faim for children with severe acute malnutrition in Nepal. Next slide. We conducted a total of 149 sessions, delivered one-on-one or in small groups during visits for nutrition treatment at the community health center or at hospital by 3 trained psychosocial agents. They were facilitated by this psychosocial agent and lasted about 45 minutes each. The goal of this session was to support parenting skills and improve care practices. So basically, mothers were listened to and supported in finding their own solutions to care for their malnourished children. And what we observed is that very often the mothers were listened for the first time about the care of their malnourished children. And importantly, the sessions were continuously supervised by a psychologist who also trained the psychosocial stimulation agent. Next. So regarding the qualitative the results of the qualitative study, on acceptability of our intervention, this first figure shows the effect of the sessions perceived by the mothers on the different relationship with their children, their families, and close contact. So the mothers reported feeling more positive emotions towards their children after the intervention. And on the other side, children seemed more alert, showed more autonomy, and slept better. Families and close contact were also more involved after the intervention, and the 5 sessions that were dedicated to the mothers, they expressed positive attitude, interest, and encouragement. And also we observed that the mother's capacity and sense of self-efficacy and legitimacy through some knowledge increased throughout the sessions. They felt more autonomous and regained a degree of self-confidence. Next. We also observed that relationship within the health structure also improved. Throughout the sessions, the caregiver expressed having more trust towards the psychosocial agent, and them showed more empathy towards the mothers. The health workers expressed more positive attitudes towards the mothers, less judgment, and there was a dialogue between health teams. Next slide. So regarding the main takeaway for this intervention, it showed a strong feasibility and was well accepted by caregivers, healthcare staff, and psychosocial workers. There was also an effective collaboration among psychosocial agents, health staff, and caregiver, and it was central to success. We saw encouraging outcomes in both maternal and child well-being and health. And there was the continuation of the psychosocial stimulation activity within the care pathway in Kutiala. We also identified more needs in different contexts and emergency settings. And we are now busy developing a toolkit for scaling up or for guiding the scale up of the intervention. Next. So just a small insight on this toolkit. So it will be adaptable to a variety of contexts, including emergency settings. It will be also developed iteratively with input from field actors and diverse stakeholders and composed of different modules. So mainly the content of the intervention, but also a module on training and also some operational guidance. Our aim is to launch it early 2026. Next. I would like to thank all the families for their time and contribution to the study, as well as our study team members and our partners, in particular Action contre la faim, Ahmed, and the Ministry of Health in Mali. Next. You can find more information on our studies in this, following these different links. We also made a short video in Mali with the team there of, I think it's 7 minutes, and it shows the pathway of care of one of the family joining the intervention. Thank you very much.
Megan, your video is, I mean, your audio has gone a bit alien. Do you want me to maybe just check your headset? It's really torturous. Yeah, until you get sorted. Okay, I'll just introduce the next session, which was around strategic objective 1. And it's from our operations team. Rasha, I'm going to hand over to you. I know Pauline was supposed to be your co-facilitator, but she had a bit of a personal emergency, so I understand that you are going to take that over. Shall I just hand over to you then? Thanks.
Thank you, Kate. Hi, good afternoon, good morning, everyone. I'm Rachel Arti, the Deputy Global Nutrition Cluster Coordinator for Field Support. I'm with you in this session with also support from my colleague Angeline Grant. Sorry that Colleen was not able to join due to family emergency, but we are here with you today. So this session is speaking about the strategic objective number 1 in the GNC strategy, which is focused on people, having the right people in the right place at the right time. So in this session, we'll go through different segments. First of all, we will have a short video to present to you the achievement that GNC operation team, program arm, and coordination arm have been doing since 2022. Then afterwards, we will have a few slides to go through together. And then we will have also interactive session of questions and answers. So if we can have the video on, please. Thank you. Enjoy watching. Okay, so we will go together through a few slides. Guys, also, please use the Q&A, bar to add some of your questions, inquiries, and we will catch up and discuss them. So for the ops team, as you can see from the video, the support that the program and coordination are providing through different forums. However, we have also faced some challenges, and we have also some priorities for the coming period. So for the challenges, for example, the continuity of the provision of the GNC core services in a phase of reducing of staffing or reduction of staffing. So recently, we have lost some of our team members, either rapid response team, consultant rosters, some of the working group members. So in that sense, we have this kind of challenge about remain or increase even the needs and the request for support while we are having a bit of reduce of staffing. Also, the second challenge related to reaching the local and national actors with GNC services. Usually, the number of the questions that have been shared with us and the support requests are coming mostly from the INGO more than the local partners. This is why we always encourage the local and national partners through different forums, through conducting also the localization chats and others, to encourage them to reach out to us and to ask for support so that we can support them more in coordination with the coordination team at the country. Resource constraint, I think this is also a general challenge, halted several activities under the localization roadmap and also the working group rolling work plans. Slower progress on some localization roadmap activities. Why? Because the system there are inherent challenges of attempting to work within a system who have been designed to and for international actors. So when we work more on the localization, it's not really the best system designed for that purpose. Next slide. For the priorities, so we are prioritizing the responsive coordination, information management, nutrition emergency programming support for the countries, either with established clusters, sectors, working groups, and also countries that will be in transition very soon from established cluster system, for example, to sectors. So we are prioritizing providing support to those countries. Also, we will advance the work on climate crisis and the anticipatory actions, where to integrate climate and nutrition risk analysis, inclusion of nutrition in the anticipatory action frameworks as well. Also, how we can strengthen more the localization agenda through further work on the localization, expand the support for local and national actors, refresh also the GNC Localisation Roadmap, keep it always up to date, explore opportunities also for the regional local technical support networks. We have some good examples in some regions about regional networks that have been established or working groups that globally we can support, but also how to strengthen their role and also establish new ones where possible. And continue to build the nutrition emergency community by engagement with the working groups, knowledge exchange, capacity strengthening, and also, like interacting with different forums. Next slide, please. So this is briefly some of the way forward regarding how to strengthen the capacity strengthening and the way forward for capacity strengthening. So we have different modalities, we have different learning pathways which are linked to the coordination, information management, NIE frameworks. Those have been like developed, endorsed, and also tailored to fit with different contexts, because we believe that one size doesn't fit all. Also, how to strengthen and expand the partnership to support the co-creation, sharing information, and also uptake learning opportunities with national institutions as well. Capacity strengthening services our different services are blended, modular, and also aligned with country-specific strategies and priorities. And also we have innovation tools like the mobile techniques, use of AI, and also enhance access, outcome, and delivery of different learning resources. And also we have always to remind everyone that GNC website, we have a lot of e-learning modules and a lot of resources that you can access anytime. Next slide, please. So operation team is committed to adapting to our ways of work, and also services to respond to the need of practitioners everywhere working in a humanitarian nutrition response. And we will continue with these commitments. So for now, I will just stop here for a minute and will give the floor to my colleague, Alexa, our localization, GNC localization help desk, who will also share with you some of the thoughts and seek also your feedback on. So Alexa, are you online?
Hi, Rasha. I am online. Can you hear me okay?
Yes,
Great.
I can. Yeah, over to you.
Great. Thank you so much, Rasha. Thank you for letting me jump on for just a moment today. My name is Alexa or Alexandra Humphreys. I do wear two hats for the GNC, and I'm actually joining you for this session as the strategy development consultant for the GNC. I just want to take this opportunity real quick to get a sense, reflecting on the session, reflecting on what we've heard. The third day of this event, we are going to have an entire session dedicated to the GNC strategy development, but I am going to take advantage of these different sessions to be quietly popping some polls or some questions in the chat. So look out for those throughout this session. I'm adding one to the chat right now. I'm going to put it in multiple languages so it's accessible for everyone. For this session, I want to reflect on, there was a slide presented that Rasha so nicely presented about such a future priorities for the GNC. And I just wanted to pop in the chat here and ask, among those four, which do you feel should be the biggest priority for the GNC? You feeding into this is going to be helpful. It helps us map the following this event, we are going to be working to develop the next iteration of the GNC strategy. So any opportunity for the collective to weigh in is really welcome. So I've put in the chat here 3 different focuses. So the question is, what do you think is the most important future priority of the GNC? And there are 4 options. Please just put numbers 1 through 4, whatever stands out to you. First, responsive coordination, IM and NIE programming support. The second is advancing work on climate and anticipatory action. Third is expanding and improving our support to local and national actors. And fourth is building the NIA community through working groups, knowledge exchange, and capacity strengthening. Feel free to just put in the chat at your leisure, numbers 1 through 4 is helpful in letting us know what is important to you and helping guide the development of the next version of the GNC strategy. This isn't a poll that's going to go away. It'll be here in the chat throughout the session, so answer at your leisure. And Rasha, back over to you. Thanks for letting me pop in real quick.
Thank you, Alessandra. Thank you. So, and thanks, colleagues, for the inputs. I am seeing like there are answers coming. This will be extremely helpful for us while we are working on designing the new or next GNC strategy. So really appreciate to have your feedback in the chat box. Now let me introduce also my colleague, Angeline Grant. Angeline.
Super.
Angeline will be moderating the Q&A session. So over to you, Angeline.
Super. Thank you so much, Rasha. Hello, everyone. My name is Angeline Grant, and I am the GNC Operations Team Deputy Coordinator. So I don't think we have any questions relative to our session just yet in the Q&A box. I think there might be some other questions there for some of the previous presenters. There's a few different questions on ECD. So yeah, do feel free to answer those directly in the Q&A box for the previous presenters. Maybe whilst we wait for some questions on our session, Rasha, I might maybe just ask you a quick follow-up question. Do you think you might be able to expand a little bit more on how the request for support process works for the different people online?
Yeah, sure. So as you can notice from the video, we do have a request button and at the GNC website. It is like user-friendly, multiple languages. So just go through GNC website and click on the support button. We have a team who is actually filtering those support requests, and also we, allocate such requests to the focal person within our team, either in the coordination, information management, program, and different working groups. And this works. And we have achieved a lot in this regard. And we are also still asking our partners to jump in and to contact us through the support button in the GNC website to let us know. And even this is also an open forum in case you are looking for some kind of GNC resources you couldn't get through the GNC website. Let us know, just also through the request button, that I was looking for these resources or any help in this field. I couldn't find anything, for example. Then we can also reach out to you and share the relevant links. So please don't hesitate to reach out to the GNC team, and we will be able to support you. Let me also repeat again that the number of requests that we are receiving from the local and national actors are still very low comparing with other actors. So we also encourage the national and local actors to reach out to us and to be able to also to support them. As you can see also from the different feedback that we are receiving in the chat box, support the localization, support the local and national actors are really considered also by these participants as also the priority. So this is the priority for the next GNC strategy and the way forward. So please also encourage this, and we will be also trying to reach out to as much as LNAs as we can. The localization team have already reached out through different localization coffee chat with different LNAs from different countries, and we will continue doing that in the coming period. Yes, Angeline.
Super. Thank you so much, Rasha. And yes, really encouraging everybody to send us your requests. I think we'll probably post the link in the chat box very shortly if it hasn't been posted already. But yes, really do feel free to reach out to the GNC for any question, big or small. We're still very much here and able to respond to your queries. And we, as Rasha very nicely presented earlier on, we have different services available, from quick remote support to in-depth support to webinar support and consultant roster support as well. So really do feel free to reach out. And I would just encourage you, if you have any questions for myself and Rasha for this session, do please feel free to post them in the Q&A box. Maybe just as we wait for any other questions, Rasha, should we maybe expand a little bit on maybe some trends that we've seen in support requests recently?
Yeah, sure. So recently, for example, the focus, different focuses for sure, different areas of support, but most support requests that we received related to, for example, the information management and nutrition information system, especially now with the changes in the HNRB development processes with GF and other processes also. So we noticed that also support request came from this perspective, but also we have supports request related also to the changing in the wasting management, the new WHO guideline for the management of wasting in general. So also that was a lot of requests came in this regard, and our also program team and wasting working group kindly have been addressing such requests. So those are mainly the highest trend that for the recent period. But as I said, we are open for any area, and also the localization. What is localization? how we can enforce and strengthen the localization. So in that sense, so I think those 4 areas have been like the biggest related to the trend of support requests received recently, let's say. Angeline, there is also, I'm saying, one question up, which maybe not directly related to our session because it was posted earlier, but I would like also to touch base on it if we have still time, yeah. So the government ownership, how easily do you think it will be for the government system to take this intervention within existing staff and resources? Okay, so this is also feed into what we were discussing about localization. And we are really encouraging the partners to reach out. And also we are happy to reach out ourselves. So this will be under also capacity strengthening and how we can strengthen the capacity of the partners. All the coordination forum, all the partners under different coordination forum, especially the local and national actors. So we have different capacity strengthening modalities. We have online trainings, we have blended approaches, and we have also the mentoring program, for example, where we have presentation from national actors and also coordination teams and others. So through this, we hope that we will be able to address any capacity gap and also, like the reduction of staff that we are facing now at all levels. Over to you, Angeline.
Yes, thank you so much, Rasha. And yeah, really important to highlight the capacity strengthening possibilities as well that the GNC can provide. And I think we've got a really interesting session on capacity strengthening, which will be coming up in the next couple of days for the annual meeting. So I think we're all looking forward to that as well. And yeah, I agree with you in terms of the trends as well. I think it's really interesting what we're seeing. I think on the PT side, we've also seen an uptick in CVA for nutrition requests, and that's been really interesting to work with the CVA for nutrition, GTWG, on organising those. And also, interestingly, we're seeing an increase in localization specific support. And so Alexa, our colleague, was in Juba recently to help support with the development of a localization action plan for the cluster. We've had other requests, similar requests coming in. So I think that's also a key part of what we may be doing in the coming months. And obviously could well be aligned with the general direction of the humanitarian reset going forward. Wonderful. Yes, I think there are some questions coming in through the chat, but please do pop them in the Q&A box. Which I think you can find if you click on more, and there are 3 dots there, you can pop them in there. So do please pop them in there. Thank you. I think Cecile is highlighting the side session next week on NIE capacity strengthening.
Yes, thank you. Thank you, Cecile. The question was about how we can support localization. Yeah, actually, as Angeline said, we can support the countries, the coordination team and the national partners in the localization action plan for the countries, how we can identify local and national actors actively, taking part in the humanitarian response, and how we can do or target them with capacity strengthening activities and share with them some successful examples other national local actors in other countries are doing. So by this, we can always be engaged with the national actors and also give them examples. And let me re-highlight that we have a very active localization working group under GNC. I think, Angeline, we have a couple also of questions. There are a couple of questions related to ECD and other couple of questions to us. Over to you.
Yeah, there's a question coming from Martin, which is an interesting one. Given the current funding constraints and dwindling resources, I'm curious, does the GNC also support resource mobilization efforts, or is its mandate strictly limited to technical support? Additionally, when local organizations reach out for technical support, is it assumed they already have budget allocated for that? What happens in cases where there's a clear technical lead but local partners lack sufficient funding to implement or engage meaningfully. Would you like to take that one, Rasha? Maybe I can complement.
Okay, dear. So yeah, we can support also the resource mobilization efforts by the established coordination mechanism. We have some good examples through supporting the coordination team and the partners in conducting global call with donors, especially with countries who are affected by emergency, like and have protracted emergencies and so on. And also, even if it is not a direct call, we have also supporting some coordination team in countries in developing some kind of advocacy note, tips that help to highlight and to speak about the issues in different countries, because each country has different challenges, also different contexts, different challenges. So yeah, we can also support in this area. Yeah, funding is a big challenge, especially for national actors. So this is why also these feed into the advocacy and resource mobilization support that we are providing to countries. But again, please reach out so that we can also identify what we can do to specifically support this country or another, for sure. Yeah, over to you, Angeline, if you would like to compliment.
So much, Rasha. Yeah, maybe just also highlight a recent experience that we've had in a few different countries where we're doing a focus country project for localization, where we were actually providing technical support in conjunction with organizational capacity strengthening. And we've seen that that's been very successful for building capacity of local and national actors to have those two combined. It provides a more cohesive and coherent support package. And so within that, yes, there was support to build capacity on resource mobilization and the development of proposals. And so, yeah, that's also something that is part of our service offer. And maybe just to respond also to the second part of the question, when local or national organizations come to us, we're very much seeking to provide a continuous package of services, and it can go from quick remote support to in-depth support to other forms of support, capacity strengthening. And so within that, there is also a lot of networking that can go on to put local and national actors in touch, more strongly in touch with, for example, the cluster in country, or maybe other international organizations in country, or providing different opportunities that may help to support that resource mobilization process. And obviously, we are also here to provide technical support as well. So yeah, combining those two, I think, is very important. Right, I think we've had a few different questions that have been answered live, particularly on the ECD. If there are any other questions, do feel free to pop them in.
There is one question about the transition plan, the last one.
Yeah.
So yeah, one of the recommendations focus on the transitional plan from the start. Could you please explain how we can implement? So yeah, so actually based on the country context, there should be a transition plan, especially if the established cluster will move to a sector or you know, other way. So of coordination. So the reduction of staffing, and now also it mentioned that national capacity is insufficient, but this is the way forward. Localization is the way forward. How we can work together, as we explained, through different capacity strengthening modalities. And thank you, CC, for posting the link also, to work with the national capacities and how to strengthen the national capacities also during this transition process. So transition is a big thing. We have a lot of resources now related to the transition and development of transition plan and so on. You can also revert to that in the GNC website. So, and this is also not related only to the nutrition cluster, but also to many clusters, many other clusters as well. So in that sense, we will be working together through this process of the transition, the operational team with the countries and with the partners to work together during this phase of transition, and how we can ensure the focus is to capacitate the national capacities and to support them in this process. Over to you, Angeline.
Angeline, Stefano, may I
Yes.
add something?
Yes, please do come in, Stefano.
Sure, Stefano, please.
Thank you very much. Now, it's the transition from the beginning. You know, it is something. It's a recommendation that sometimes feels a little bit not adequately backed up by the funding and the capacity in place or that we expect to have. To be fair, as I said in my presentation, the nutrition cluster has traditionally been one of the clusters which has had more opportunities, perhaps, but really a strong focus on supporting national leadership. As I said, I was cluster coordinator in Haiti in 2010 to 12, and really we worked very much behind and in support of the national authorities' leadership. And that has been the case in most countries. Obviously, in some countries where the national authorities or the national governments are part of a conflict or are unable or unwilling to adopt humanitarian principles, which we need to stand by, then that becomes a little bit more challenging. But the reality is that beside very few countries where that constraint is in place, the nutrition cluster really works in full support of national authorities. That makes a transition. So basically, we are activated not to replace national authorities, but to support national efforts. In some countries, this national effort, national support of national effort has been ongoing for many, many years. That will no longer be possible, primarily due to funding constraints, but also because really it is fair to say that when this international effort to support national leadership is done in a way that really doesn't necessarily fully empower or fills the gaps in with a foreseen handover, then it may actually be supporting a protraction of this dependency on external support. National authorities are, it's in their mandate, the first accountable component of humanitarian effort and responses, and they are involved in the development, from the conception of the needs, and they need to also own a transition and a phase out. Now, how this will gonna be working in consideration of the new humanitarian constraints and funding cuts, they will be very difficult. In many countries, the nutrition cluster is not there because we want to maintain a presence there. It's there because there are gaps in sector coordination and intersector collaboration that are not easily filled, and we will need to find together. The nutrition cluster is not just our team here in Geneva or at the country level, it's all of us. We need to find ways on how we can make sure that we, in all the choices that we do, that the humanitarian action, even with less funding, really contributes to resilience building. And that resilience means, in many cases, strengthening national and subnational capacity, but also really providing different type of support over a more protracted time. So this will be coming, and again, not everything is going to be just ideal, and we have to face many important changes and constraints. But I'm sure that the nutrition cluster has been in these terms, in terms of localization, in terms of support of national authorities, really a guiding model for many other clusters and other development and humanitarian efforts. and will continue to be. So with your help, I'm sure we're going to find the most effective solution. But again, we are going to face important challenges, and not everything is in the future is going to be ideal. It's a different world, and we're going to seek out the opportunities where they are available and maximize them wherever possible. Thank you.
Thank you, Stefano.
Thank you, Stefano, for those encouraging words. Yeah, it's all good food for thought. I think maybe we don't have any further questions. I think maybe, Russia, would you like to maybe close out our session?
Yeah, thank you, Angeline. And thank you, everyone, for the great questions. And you can reach out to us anytime, wherever you are, as we explained. So over to you, facilitators. Over to you, Megan.
Great. Thanks so much, Russia and Angeline, for stepping in also at late notice for this session. Okay, so colleagues, we are going to be now moving into our 3 options again. So similar to before, we have a lightning talk, which is going to be by our colleague Alessandro from FHI 360. This is going to be a session on the barriers and facilitators to women's access and utilization of nutrition services in a humanitarian context. You'll also have the choice to join a networking session or take a coffee break. So just before we go into those sessions, I'm just going to hand over to Shayna, who's going to just give a little bit more information about how to join those breakout sessions. And then we will be rejoining in 10 minutes. Over to you, Shayna.
Thank you so much. Oh, sorry about the sun. Just wanted to apologize. I know there was some confusion about the breakout rooms. Unfortunately, because of how we have to set up the meeting, there are some breakout rooms you will see that we are not using until later on in the session. So currently, so if you can't see the sessions right now, you will go down to the More option. That is the circle with the 3 dots at the bottom of your screen. You will see the option for breakout rooms. You will see multiple options. However, the only option that is going to be available right now is the networking session option. So if you would like to join the networking session, you will click join, and then there will be a pop-up where you confirm and join that session. If there's any questions about seeing this breakout room, I'm looking at the chat right now as well. If someone isn't able to see it or can confirm that they can see it. I see people joining it, but it says not yet joined. So again, remember, if you click join, then there should also be an option to then confirm that you are going to that breakout room. Okay, great. It looks like people are joining. So hopefully if you want to join that networking session, you can do that. Again, all of the others, the only session that is currently open is day 1 to 3 networking. Not any of the other sessions. Those are going to be used at a later time. And again, apologies for the confusion about this. Day 1 through 3 networking is the only current option. If you go down to the bottom of your screen, there should be a circle with 3 dots in the middle, and it says More. If you click More, you should be able to see the option to join a breakout room. And people are saying it's on the last of the list, day 1 through 3 networking. Okay, it looks like people are joining, so I'm gonna go ahead and hop off so we can continue with the lightning talk. Thanks all. We'll continue to answer questions in the chat though, so if you're having trouble, let us know.
Thanks so much, Shayna. And just to say, this session is 10 minutes, so we will be rejoining 10 minutes to the hour. Over to you, Alessandro.
Thanks, Megan. I prepare a recording and I would prefer if the team can run that recording. Thank you. Thanks.
Hi everyone, we are just having a small issue with loading the video. I suggest everyone just take a minute, use the bathroom, grab a drink, and we will have this video loaded shortly.
Good morning or good afternoon.
I'm gonna go ahead and share our post. Oh no, it looks like maybe we've got it. Never mind. Thanks all for your patience.
Good morning or good afternoon, everyone. It's really a pleasure to be here with you today. My name is Alessandro Riellamo, the Senior Emergency Nutrition Advisor for FHI 360, And I'm making this presentation on behalf of the FHI 360 Yemen team that actually work on this initiative. Today, I will be sharing findings from a qualitative community inquiry led by FHI 360 in 5 crisis-affected districts along the west coast of Yemen. These are areas where FHI 360 has been implementing an integrated humanitarian response, focusing on health, nutrition, and wash. To ensure that our interventions were truly responsive to women's lived realities, we conducted 17 focus group discussions and a set of in-depth interviews with mothers, husbands, community health volunteers, and frontline health workers. The goal was really to understand what enables or prevents access to life-saving nutrition services to the communities that we were trying to support. Participants were drawn from families living in, as I said, in FHI 360 supported communities and included pregnant women and mothers of children under 5, including women, mothers of children who are enrolled in the SAM mom treatment. We also involved husbands of women that were referred, as well as members of the mother-to-mother support groups that we were supporting. We have included community health volunteers and those health workers that are providing nutrition services in our supported facilities. In total, the study targeted more than 285 participants, as I said, across 5 districts, using structured FGDs and IDIs, and these were guided by the correct qualitative research framework. Sessions, the FGD sessions, were conducted independently from the mother-to-mother support groups to avoid fatigue and ensure safe and open sharing. We wanted really to highlight some of what the women, what the mothers have to say. And women described overwhelming barriers to access nutrition services. Among the mostly cited challenges is the long distance, and I quote, the long distance, these are translations from the actual quotes that the mother shared with us. The long distance to a facility and the lack of someone to care for the home and children that are left behind are significant challenges. The inability to afford transportation costs, the heat, the exhaustion from walking are major barriers. Others also said that we face challenges reaching the facility on time. If we miss the scheduled day, we are told to come back sometimes another week, but we can't afford that. And sometimes we or our children are too sick to make the journey, and there is no one to go with us. So as you can see, the responses, the highlights or reflect a layered type of realities that reflects the poverty, some gender norms, fragile infrastructure, and the heavy maternal workload. But women, and that was really also equally important, women and their family also describe what made access possible and meaningful. We really appreciated when they share the appreciation they have, no? And that's what they have to say. There are volunteers in the village identified through weekly home visits. They give awareness sessions about child nutrition, breastfeeding, and hygiene, and refer children to health facilities, and refer malnourished children to health facilities. The volunteers, they measure our children and explain things clearly. Their visits have significantly improved our understanding. Volunteers raise awareness about proper practices. At the facility, health workers treat children with kindness and give us follow-up plans. The volunteer session helped correct harmful misconceptions and led to better hygiene and nutrition practices in the community. So consistent home-based outreach, female-led engagement, and respectful health worker interaction stood out as the strongest, among the strongest enablers. So again, let me also be clear, this inquiry was not an academic exercise. It was a practical tool to help us redesign our approach on the West Coast. Thanks to the voices of 285 women, men, community health volunteers, health workers, FHI adapted its nutrition strategy to expand community-based delivery platform, to support trusted female volunteers with regular training and supervision, and aim at improving the transport-sensitive referral pathways. At the same time, increase the consistency and respectfulness of service delivery. It is clear availability does not equal access. Listening to community voices is what bridges that gap. We thank the mothers, fathers, community health volunteers, and health workers who shared their time and story with us. This work shows that in emergency, nutrition programming must do more than deliver. It must connect, it must respond, and it must respect. Thank you. Thank you so much.
Thanks so much. I would say thank you, Alessandro, but that was a recording, so I think Alessandro had to drop off. Hopefully people have returned from the networking, if they did join the networking. And we are now about to embark on session 3. We're going to focus on GNC working group updates. So maybe, Ben, could we get the next slide and we'll maybe give it another minute, make sure everybody's back. This is under strategic objective 2, operational and technical support. And I am going to hand over to Miriam Yanakis, GNC Operations Management Group. Miriam, are you ready to take us through the breakout sessions from each of the Global Nutrition Cluster working groups?
Thank you, Kate. I'm having difficulty with my connection, so we're going to use recording for today.
Perfect. Great. So I think Ben is probably queuing that up. Great. Thank you.
Good day to you all, and great to see all the participants here. Great to see familiar names and lots of new ones as well. I hope that you will find the time that you spend with us over these next few days valuable and inspiring to you in your work. Welcome to session 3 on the GNC working groups. My name is Miriam Yanakis from the GNC Operations Management Group. This group provides support and coordination to the GNC working groups, among other things. The other members of the Operations Management Group are Colleen Emery, Rasha Al-Ardi, Angeline Grant, and Cecile Besguin. To get started, let's just take a step back and clarify why we have working groups in the first place. Each working group has a terms of reference that is based on a template, but is adapted to be relevant to the particular context of that working group. The process of adapting and updating is led by the co-chairs with involvement of the members. There are a few key purposes of the working groups in the GNC centered around collaboration and serving as subject matter specialists. A key function of the working groups is to develop new interim consensus-driven guidance and provide nutrition and emergency advice, where, for example, translation for practical implementation is needed. The function is in direct response to requests for support from practitioners whereby a challenge or a question has come up and requires expert advice on how to move forward. The working groups also continue to identify knowledge management and learning needs and respond accordingly, for example, by bringing it to the attention of the GNC for action, by collaborating with other working groups, by developing guidance, or by providing advice directly in response to the requester. In these efforts, they identify and facilitate the sharing of experiences across geographic levels and horizontally within these levels. Each working group takes their own approach to this work. Based on what the working group is learning, they may decide to host a webinar to showcase innovation in the field or to update on new resources available. The working groups are also responsible for keeping the GNC informed of achievements, lessons learned, and unaddressed nutrition and emergency challenges. By doing this work, we are able to make progress under strategic objective number 2 for operational and technical support in the GNC 2022 to 2025 strategy. So what working groups are there? I bet you are familiar with some of them, but maybe not all of them. These are the working groups that are currently active. We are thankful to everyone that is involved as members, as co-chairs, reflecting the true collective nature of the GNC to do all of the work that's completed by these groups. The Infant and Young Child Feeding and Emergency Group is hosted by the IFE Core Group, led by the Emergency Nutrition Network, ENN. MAMI, Managing Nutrition Needs of Vulnerable Infants Under 6 months and Their Mothers, is hosted by the MAMI Global Network, led also by the Emergency Nutrition Network. Management of Wasting is hosted by IMC and UNICEF. Nutrition and Cash and Voucher Assistance is hosted by Concern Worldwide and Save the Children. Nutrition Information Systems is hosted by ACF. Anti-Racism and Localization is hosted by IMC and ACF. Climate Crisis is hosted by the WFP and the French Red Cross. Disability Inclusion is hosted by UNICEF. Gender and Gender-Based Violence is hosted by Save the Children. Humanitarian Development Peace Nexus is hosted by N4D and the Scaling Up Nutrition Movement. Early Childhood Development and Emergency is hosted by UNICEF and ACF. Advocacy and Communication is hosted by UNICEF, and Nutrition and Emergency Capacity Strengthening is also hosted by UNICEF. In 2024, working groups hosted 11 webinars covering a variety of topics, including a series on early child development and emergencies, a series on infant and young child feeding and emergencies, and multiple standalone updates on new resources and lessons learned around cash and voucher assistance, gender and gender-based violence, nutrition information systems, and several more. The resources associated with these webinars, including recordings, can all be found on the GNC webpage. In addition to the webinars, there are multiple products coming out of the working groups. The ones pictured here are just a few. You will see the Anti-Racism and Localization Group produced a document on linguistic inequality in nutrition and emergencies. The IYCFE Working Group, as part of the IFE Core Group, and the GNC produced a joint statement on infant and young child feeding in the context of MPOX to respond to the need of practitioners. The IYCFE Assessment Guide was shared through a webinar to ensure practitioners knew of the resource and are familiar with how it can be used in their work, and several other products, such as the Gender and Nutrition Analysis done with the Gender and Gender-Based Violence Working Group based on learnings from Ethiopia. So are you interested in contributing to the work of the working groups? Well, if so, stay tuned, because in a few minutes, we'll have breakout rooms for a meet and greet with the co-chairs of the working groups. More about that in a moment. I just want to draw your attention to the resources available to you currently on the GNC webpage. It's a good place for you to go to find out more about what each group is currently prioritizing and working on. So if you go to the GNC webpage, look for the Thematic Areas tab. Once you click through to the working group, you'll find a contact email that you can use to express your interest. You can also use a QR code that's on the screen now. Okay, now let's give you a chance to connect with the co-chairs. There is one room for each of the working groups listed here. In these rooms, the co-chairs will provide you with some updates on who they are, and what they are doing. You may even get an invite to join in the work. The co-chairs are there to answer any questions that you might have. Note that simultaneous interpretation will not be available in the breakout rooms. The co-chairs have indicated what language they would be comfortable with for this question and answer period. We will have 20 minutes for the breakout rooms. After that, we will meet back here for session 4, hosted by the Early Child Development in Emergencies Working Group. The very observant among you will notice that the Climate Crisis Working Group is not on this list. This is because there will be a dedicated session on day 3, so please stay tuned for that. Feel free now to join any of the breakout rooms that you're interested in. I encourage you to attend a breakout room with a working group that perhaps you are less familiar with so that you can learn more about the work that is going on. Let's now open the breakout rooms and you can choose which one you would like to go to.
Thanks, Miriam. I think you're listening, but that was a recording. So now, if everyone can, we have 19 minutes to go to your breakout rooms, and hopefully, as Shayna explained previously, you can see now your choice of breakout rooms, and you choose the one that you want to go to. Yeah, can you see them all? It should be pretty much everything on that list. Is a working group breakout room. Looks like people are going. Great. Yep. Good. So enjoy. And if you have any problems, just put it in the chat. How can you choose breakout room 8?
You should just be able to click on join, and then there will be a pop-up box that says, you know, join breakout room now or something like that.
Good day.
If people are still in the main room and having some trouble joining the breakout rooms, once again, there should be a button if you don't see breakouts as an option at the bottom of your screen, there's a more icon. It's a circle with 3 dots. Click on that and you should see the option for breakout rooms, and then it will pop up with all the different names of the different working groups. You should be able to click join and then join that group. And yes, for the interpreters, there will be no interpretation while people are in the breakout rooms. So have this time, hopefully, as a little break.
early child development, what is nutrition. So yeah, even
Okay. Hi, welcome back, colleagues. We'll just give another couple of seconds for everyone to rejoin from the breakout rooms. Okay, we are now moving into session 4 on early child development. Welcome back from the breakout sessions. A gentle reminder to all of our speakers to please speak into your microphone and slowly, considering that we do have the interpretation. Okay, I would now really like to introduce Najwa Al-Deeb, a program specialist at UNICEF HQ, who is based in Nairobi. I will hand over now to Najwa to give us an introduction of this session on ECD. Over to you, Najwa.
Thank you, Megan. Good morning, good afternoon, good evening, colleagues, wherever you are. I'm honored to welcome you all to this session as part of the GNC Global Meeting. I'm Najwa Al-Deeb, the Technical Working Group Lead for Early Childhood Development and Nutrition Emergency, along with Colleen, who is unfortunately not available today. It is a privilege to be here with partners and practitioners who are deeply committed to improving outcomes for the youngest and most vulnerable children in crisis settings. This session focuses on the first 1,000 days, a period that lays a foundation for lifelong health, nutrition, learning, and well-being. We will hear from 2 country programs that are pushing the boundaries of what is possible when we say integration around nutrition, caregiving, and stimulation in fragile and humanitarian contexts. First, we will dive into the experience from Palestine, from nutrition to nurturing care, the impact of an integrated first 1,000 days, intervention on child development, and feeding practices. A program used a comprehensive approach, combining maternal and infant nutrition support with responsive caregiving and stimulation, demonstrating how integrated service delivery can improve not only feeding practices, but also child development outcomes by addressing both the body and the brain. Then we will move to Cox's Bazar, Bangladesh, where we will explore the impact of remote and hybrid programming on early childhood development and nutrition for Rohingya refugees and host communities in one of the world's largest refugee settlements, an initiative adapted to major access challenges by using hybrid and remote methods to reach families with ECD and nutrition intervention. Following those presentations, we will open the floor for questions and discussions and close by highlighting some practical tools and resources that can support integration of ECD and nutrition emergency across different settings. With this, can you move to the next slide, please? In this session, I'll be facilitating. You will have Hannah Rabadi and Katie Murphy and Rashid to present the case studies. Next, please. Yeah, next. If I could ask you all, please, with Andy, is Andy around? To scan the QR code for these 2 questions. Andy?
Najwa, I understand that JSI is going to be sharing the screen for the
Yes.
Menti. If not,
Yes.
I'm here to do so.
They are. Okay, so just please scan your QR code, this whatever you're seeing now, and then a couple of minutes, we will present the answers. There are 2 questions. One is, what is it that you are doing now in your organization around ECD interventions with nutrition emergency response? And the second question is around, what is it that you expect from the ECD technical working group, or what is it that you want in terms of support when it comes to ECD and nutrition in emergency? With that, if GSI can present the popping answers. don't see the answers popping up, so.
Sorry, we are trying to figure out. I think we need to still ask people. Sorry, there's a link in the chat now. I believe the QR code only took you to these presentation slides and not to the actual Mentimeter. So that Miriam has now shared a link in the chat, and that should take you to the actual poll. Yes, it will take you to the poll. So a couple more minutes for people to answer. Thank you. And please, again, the interpreters are asking just to remind everyone when they're speaking to please speak. I know it's sometimes hard to slow ourselves down, but please speak slowly as possible so they are able to capture what you're saying and share that with those who are listening into interpretation. Thank you so much.
We can give another 1 minute for this question, and then we'll go to the second question. Okay, we could see that most of the answers around trying to integrate ECD in every contact point with families. Good. Responsive feeding, baby-friendly initiatives, nutrition activities such as IYCFE, child development specialist on the staffing, mainly focused on mother, including relaxation, establishment of playing areas and breastfeeding corners, and baby-friendly spaces, nothing at this time. Child-friendly spaces is coming up strongly. Supporting maternal mental health, good. Integrating with IYCF ECD corners, responsive feeding, child milestones, and usually physical and cognitive in stabilization centers, toys in stabilization centers for play. We don't have any supporting mothers and caregivers, baby-friendly spaces, exclusive breastfeeding promotion, blended ECD model implementation. I think this is good. Keep doing that. Keep the answers coming, but can we move to the next question, please? I hope the second question has popped up. Yeah. Yeah. Use the link. Oh, okay. Can you allow the voting because it says it's not open for votes yet? To answer the second question.
Can people maybe put their answers in the chat? Apologies for this, but I think
okay.
instead of
so,
yeah, just have
so we
people.
are having Yes, we are having a technical difficulty. So for that, can you please write your answers on the chat box? What support do you need to promote early child development activities as part of your nutrition response? Please keep the answers coming in, and we will be collecting the answers moving forward. With that, can I move forward with Hannah, please, as our first speaker? Hannah, over to you.
Yes, thank you. So I just want to confirm that my voice is clear.
Yes.
Okay. So hello, everyone, and it's my pleasure to present today the research that we have conducted regarding nutrition and early child development. And this research was conducted in Palestine, West Bank communities. I will go through the communities that we have targeted. I would like to introduce myself at the beginning. My name is Hannah. I work for World Vision based in Palestine, work for the Jerusalem, West Bank, and Gaza office. Next slide, please. So what we have been doing is that when we started implementing our nutrition intervention, we used a model called timed and targeted counseling. And with time, we have figured out that we need to integrate more of other components that we believe that are very important for child development as a holistic approach. So the nurturing care framework was the driver to our thinking. And we thought that for holistic child development, it's not enough to focus only on nutrition, but we need as well to include some health components, some early learning, safety and stimulation and responsive caregiving to be part of what we are delivering, and to see whether those components can be integrated in a way that is acceptable and is not even creating a load over the implementers and over the caregivers. So we wanted to check on this and see what could be the results if we are integrating those components and how it will be perceived through the communities and the community health workers. So next slide, please. So our methodology is that we said that in order to make the best, let's say, improvements and see the best outcomes, we need to target mothers as early as possible. So what we did is that we have identified mothers when they were in their second and third trimester in order to make sure that we are targeting them on time for early for initiation of breastfeeding and for exclusive breastfeeding. So we identified them when they were in their second and third trimester, and we have selected 26 vulnerable communities located in different governorates in the area of West Bank. So for this, we have done a cluster randomization. We couldn't do like a beneficiary randomization because we don't want any contamination. So we did cluster randomization. So what we did is that we have included mothers in each cluster to be assigned to either the intervention or control group. So our sample size was 469. We have assigned 238 to the intervention group where they received the integrated package, and I will discuss more about this integrated package. And for the control, they were 231 and they received not an integrated package, a package, but it's not as comprehensive as the integrated one. For data collection, we used like mobile and tablets to collect the data, not paperwork. We use field task or SMAP to do this kind of data collection. And the tools that we use is for the nutrition, they are the same standardized questions that are used in the mixed study and other related studies. And for the child development, we used ages and stages tool. I just want to make sure that my voice is still clear. Do you want me to slow down, or is it okay for those who are translating? Shall I move forward with the same pace?
Yes, Hannah.
Could slow down a little
Thank
bit.
you.
That would be great. Thank you for asking.
Okay, thank you. So next slide, please. So for the integrated package, as mentioned, we have included different components that are aligned with the nurturing care framework. So we have the early child development, and it was through a model called Go Baby Go, and it was integrated at the beginning into a model that we used to implement called timed and targeted counseling, which is a behavior communication change for the first 1,000 days that focus on nutrition and child health and focus on illness management. So the Go Baby Go model was another model that's focusing on early child development, and both were integrated into one package where parents are receiving like the completed package, where they have working on their promotion regarding early learning, stimulation, regarding nutrition, all the nutrition components like breastfeeding, initiation of breastfeeding, duration, exclusive breastfeeding, proper complementary feeding, illness care, and immunization, in addition to psychosocial support to mother whenever it's needed. So this is the integrated package that we used. So it's mainly integrating early learning stimulation through the Go Baby Go model into a model that we used to implement, and it was a very evidence-based successful model called timed and targeted counseling, which is delivering timely message on a timely basis for mothers and those who care for the children. As for the control group, they only received part of these interventions, which are mainly those that are related to nutrition only, not the early child development, not the early learning and the early stimulation part. So this is the methodology and how we have designed our intervention to see the changes within the two groups. Next, please. So our model is implemented through our trained community health workers, where they are visiting the households of the mothers and they working with them directly. They are like addressing things that are important in order to ensure that they are doing the proper practices, and through as well community gatherings. So it's a mix between household visits and community sessions. So as for the findings, regarding the feeding practices, here we compared the difference between the two groups, the intervention and the control. Although both received the same exact, let's say, intervention regarding nutrition, but here you can notice significant difference between the intervention and the control. For example, the first indicator is on exclusive breastfeeding. You can see a significant improvement among the significant results among the intervention in comparison to the control. In regards to timely complementary meals, you can see the difference from 76 to 59. In regards to introducing minimum meal diversity, the same. You can see that it's higher among the intervention group compared to the control. Same for introducing a minimum meal frequency, and here as well you can see a significant difference. Although here, as mentioned earlier, both receive the same nutrition, let's say, intervention. Next slide, please. And as mentioned, we used ages and stages to measure child development. So if you look at the 12-month, only the 12-month, you can see that the mean difference between the two groups in 4 of the domains that ASQ is measuring is as well significantly higher among the intervention group. And this is, of course, expected since we implemented early learning and simulation through the Go Baby Go model that we have implemented with the intervention group. And here you can tell and see the significant difference between both groups. The orange line is the intervention and the blue line is the control. And if you look at the end, it's the 12-month milestone. Of course, we have measured ages and stages at different timelines at the age of 2, 4, 6, 8, 10, and 12. But here, because of time, I'm only presenting the 12-month, which is at the end of the slide. Next, please. So for ECD, like what if we implement standalone ECD interventions, usually the effect size is between 0.2 and 0.5. While in this study, we have measured the effect size we have measured the effect size of the integrated package on developmental domains, on the different developmental domains. And as you can see, the range is between 0.4 to 0.8, which means that the integrated package, the effect size is much higher than a standalone ECD interventions. And this as well means that integrating mainly nutrition within the ECD is going to generate better results among children, not only in the nutrition indicators, but only in their holistic development. Last slide. So finally, as a recommendation, this study confirms that integrating early child development within nutrition, especially in areas where, let's say, emergency is something that is like happening or predominant, is very important because, as mentioned, we are not only looking for survival, but survival and thrival. And even for survival, it can be much better and generate better results if we integrate nutrition into other components like ECD and even health and other major components like mental health and psychosocial support, because we have as well good results showing even the mental health of the mothers, how even it affected even the how mothers are responding to the needs of their children. Of course, it's always important because of the, let's say, the emergency situation. It's important to build on the capacities of the communities. It's important to include communities in all of these steps and let them own this, because even with, let's say, in a fragile context, in context where we don't have enough services, it's very important that we include our community health workers, of course, taking into consideration their needs, their load, and always make sure that they are doing well, and always checking as well on their mental health and if they need any support, and do this as part of the whole package that we are integrating. So this is in summary what we have been implementing. Thank you, everyone.
Thank you so much, Hannah. That was really an inspirational study and such a powerful example of how early childhood development can be integrated using the Go Baby Go model. We're going to transition now to Bangladesh, and hopefully this also provides you with an inspirational type of approach, particularly for very complex environments where there may be low literacy, very limited access. So my colleague Rashid and I will go through the Zindagi Goran initiative that we implemented in Cox's Bazar and the surrounding host community. So to provide quick overview of the context and the situation, I will pass it to Rashid, and then I will go through some of the study findings from the randomized control trial that we recently completed. Over to you, Rashid.
Thank you, Katie. Good evening, everyone from Bangladesh. So I will start with a brief overview of the context here in Cox's Bazar Rohingya response. Can you go to the next slide, please? Yeah, so the Cox's Bazar district is actually situated in beside the Bay of Bengal, and it shares a large border with Myanmar that make Rohingya population, over 1 million Rohingya population displaced from Myanmar to Bangladesh in Cox's Bazar region. And of them, about 52% are children. And those children are living in a very harsh environment with having malnutrition, lack of proper food, insufficient wash facility across the camps, a high risk safety and protection issues, even also the inadequate child and maternal care support system there. So we found in as of 2023, children in the Rohingya camps, about 41% are uh, 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 diagnosed as a stunt growth, and also that impact in the host community, about 25% of the host community children. Can you go to the next slide, please? So here, based on the needs, and we identified with a need assessment in 2022, just before the COVID hit. We came up with a model that we call Zindagi Garon. It means building the life. So we come up with an integrated health, nutrition, and ECD intervention model, where we provided the pregnant and lactating women with awareness and sensitization with the needful messages. We used both remote and hybrid model, where we used our an IVR system, interactive voice response mechanism, where we use the messages to deliver onto the phones, and also we used our ECD facilitators in-person home visit model. So we designed this model in 2022, and we piloted them, and we go to the full implementation model in 2021 as well. And recently we closed our RCT on this model to see its impact as well. So when I was talking about the messages, so what the messages were look like, we shared with the caregivers to raise the develop the knowledge and practices. So our program, the Zindigon model program, combines some behavior informed messages with health system referrals. Most of the content was derived from ICDDRB's local adaptation of the Reach Up and Learn curriculum. We are very thankful for ICDDRB for partnering with us on that. The messages we delivered were promoted play and early learning activities, as well as basic nutrition, primary health, and mental well-being. So we tried to reach both mothers, other family members, in-laws, father involvement, those things. So we delivered as it is. So we prioritized our age group was actually 0 to 36 months of age children and their parents, and secondarily we also reached the in-laws and other community members as well, who are supporting for the children's development. So from here.
Okay, I think we can go next slide. I think we lost your voice, Rashid. But this leads us to the research design. And thank you so much, Rashid, for that great overview. So we wanted to study what were the impacts of remote only, so the pre-recorded phone calls and the follow-up facilitated phone calls, compared to remote plus home visiting. So we conducted with ICDDRB a 3-arm cluster randomized controlled trial. We included in this study 1,503 mothers and their children, 632 from the Rohingya community, and 871 from the host community. And they were randomly divided, or the clusters were randomly divided into these 3 groups for a duration of 6 months. Next slide, please. Our starting hypothesis was that very likely the hybrid, so the combination of the remote plus the home visits would have the highest impact. But we were delighted to see significant impacts for both the remote and the hybrid program in cognitive and language skills of young children. And this was measured through the Bailey scales. And we did not find significant effects on motor. And when we compared these, the remote and the hybrid arms, both of them being significant compared to the control group, there were no significant differences between the two. So both the remote and the hybrid, according to the power of this study, were pretty much on par in terms of their effects. Next slide, please. Very large significant outcomes in terms of home stimulation in the improvements of the home environment for both the remote and the hybrid groups, as well as significant positive effects on parenting knowledge and parenting practices. We did not find significant impacts for either arm for maternal depression. Next. And interestingly, we also found significant effects on nutritional outcomes. So for the hybrid, the model that included the home visits, there were some significant effects for weight for length, which we did not anticipate. And this was likely not due to the remote intervention alone, but as Rashid mentioned, that the services, both the messages and the in-person consultations, included referrals to other support systems. So they were likely getting more direct nutritional interventions through those referrals, but they would not have likely received that type of support if it weren't for this intervention. And then interestingly, for those with very low growth, we found that the impacts were even greater, particularly for the hybrid model. Next slide, please. So our key takeaways for this, and I want to also mention that we added a costing study. We found that the remote-only program was about half the cost per child or per household compared to the hybrid model. And so this provides a really inspirational, interesting example of how light touch remote interventions can be used to promote behavior change, using these audio-based messages, even in very low literacy populations, providing that holistic support in low resource settings, and can be cost-effective at scale, which is a really interesting opportunity for integration in future nutrition response. So I will stop there so that we have a few minutes for questions, and thank you all. Over to you, Lana.
Hi, this is Lana Drivdal, consultant in ECD, supporting the GNC working group on ECD and emergencies. I'm just looking at the presentations we've had, and I would like actually to add Claire Bossard's presentation to this cluster of presentations, because even though it wasn't called ECD, it was called psychosocial stimulation, it is actually part of promotion of child development, right? So actually, we should have been grouped together as 3 presentations, right? And in addition, there'll be presentations coming up on maternal mental health, and as we know, caring for caregiver results in supports child development as well. So you can keep adding to what actually ECD is, what it consists of. So in terms of questions, I don't think we have a lot. There is one looking at the costs of the control versus intervention arm of the studies that Hannah has shared. And I'm wondering also maybe, Katie could also talk about the costs a little bit, because this was highlighted in the beginning, that really now in the climate when our funds are reduced, we need to really look at the cost. So maybe Hannah can be the first one to answer the question, and then maybe Katie can add on the cost of the intervention. Thank you.
Yes, so thank you for the question. Regarding the cost, if we are comparing the integrated package with the, let's say, normal or the standard nutrition intervention, the cost is the same. So because we are integrating the exact, like it's a home visit, but what we are doing is making it more or adding to it another component without even extending the time. It's using the time when mother is breastfeeding her baby, or asking the mother when you are, for example, cooking or when you are doing the housework, just include your child, just talk to your child, just doing things with your child, play with your child, using even the materials inside your house on how to teach the child, like about the size and about the colors and about everything. Just go out with the child and just point at the tree and point at the bird and point at the different things. So in terms of the cost, for us, it's only the training for the community health workers where we had to add several days for training. So it's not adding any additional cost on the intervention itself. It's only for, let's say, the preparation phase where we need to equip them with the required tools and do an extra of 4 or 5 days training. And that's it in regards to cost. Of course, the other things related to the data, the dealing with the data, still we are, as we are using the digitalized forms, it's like much easier than before because earlier we used to use the paper questionnaires, which needs a lot of time for data entry, and we have to pay for data entry and analysis, but we are not doing this anymore. What we pay for the community health workers is incentives to cover their main transportation and communication to go to the household. And this is the main thing that we cover. And in some areas, we have established the child-friendly spaces as well, and the cost as well of, establishing those child-friendly spaces. But those spaces, it depends on the budget availability, and it depends on, the situation of the primary healthcare center, whether there is like a space to do it. And usually we get as well community contribution whenever we are putting things within the communities. As we are working with the Ministry of Health, for example, they are supporting as well in providing the space to do the community activities, the community gathering, and the space for the child-friendly spaces. And as well, they are supporting with the training. So sometimes even they are helping us with the training without any fees. So this kind of partnership is as well really important and critical because we want as well to sustain this work. So sustaining this work through building the capacity of the communities and through as well building a good partnership at the community level and especially with the Ministry of Health. So this is regarding the costs.
Thank you. Just seeing that we only have 2 minutes, I saw there was a question to Bangladesh study team as well. So they look at implementation findings. So Katie would like to talk about that a little bit.
Sure. I will pass it to Rashid, who I think can respond based on his direct experience on the ground. I'll also try to add, we have an additional costing study that I can try to share to provide further details on that. It was $98 per household for the remote only and about double that for the hybrid, which given this was a small scale, we've modeled that this could be much lower cost if it were implemented at a broader scale, particularly once the content is already developed, because there's a lot of the content development piece that is resource heavy. Rashid, do you want to respond to the question on implementation? If you're there. I don't know. Can you unmute or is it working? Okay. Well, I think he's having some challenges, but we did find high levels of satisfaction in terms of feedback from the caregivers and from the trainers. We found it to be highly feasible in terms of integrating into existing, routines in the household and things like that. One area where we'd like to see more is further integration within health and nutrition systems. So we had referrals from health clinics, but I think that there's a lot more that we could do in terms of ensuring that this is standard practice in terms of the type of support that pregnant and lactating women receive, so that they're connected with these key messages and additional services, and a means for identifying those most vulnerable so that they can get even more additional support. Thanks.
Thank you so much, both presenters and people who ask questions. I think that a couple more small questions that maybe are in the chat, so maybe Katie and Hannah can follow up. And Najwa, over to you.
Thank you so much. This is just to highlight we are closing. There are a couple of tools that are available for you in terms of what you can include in preparedness, in response, and for monitoring. Please look at these resources. And I have received a couple of questions on capacity building and fact sheets and so on. Please feel free to raise this request through the GNC website. With that, I thank all the presenters for sharing such powerful and practical insights from Palestine and Cox's Bazar. These experiences clearly highlight how integrated programming, linking nutrition, caregiver support, and early estimation can create meaningful changes, even in the most challenging emergency setting. Let's continue this momentum beyond today through our collaboration, knowledge sharing, and by centering the needs of young children and their caregivers as one unit in every humanitarian response. Over from my side.
Thanks so much, Najwa and colleagues. That was great. And yeah, there was a lot in the chat, so maybe just check if there's anything else that needs to be answered. So I am going to quickly hand over to Lonnie Trenuth. There you are, Lonnie. Lonnie supports the Cash and Voucher Assistance for Nutrition Global Technical Working Group as the CVA advisor, and she will be moderating this panel. And then at the very end, the very, very last session is a recorded lightning session from Sisai Makonnen of FHI 360, and then we'll close. Thanks. Over to you, Lonnie.
Hi, everyone. Thanks, Kate. Good morning, good afternoon, good evening to you all. We will be having a panel discussion about how to or how not to do research on CVA for nutrition. We'll have 4 panelists that will be presenting some of their results or their guidance and advice. And they will be providing as well some links to you for follow-up if you're more interested in the results of the studies. And we won't be having any particular time left over at the end for Q&A. So please, if you have any questions during the presentations and the discussions, you can drop them in the chat box. And Diane Moye, who's the co-chair of the Global Technical Working Group for CVA for Nutrition, she'll be monitoring and managing that chat box. She's also a nutrition advisor for Concern Worldwide. So we'll just launch right in. Next slide, please. We'll have the first presentation by Patricia Welch. She's a senior humanitarian technical advisor for Save the Children. And take it away, Patricia.
I'm sorry, Patricia. Can you please unmute? We haven't been able to hear you. Sorry. Thank you.
So how about we jump over to Shelley while Patty, you try and sort out your audio there. Shelley, are you available to jump in?
I am.
Yeah, great. We can hear you. Could we do the next slide, please? And then we'll just go back to Patty after. Thank you.
Great. Well, thanks, Lanny, and thanks everyone for the opportunity here. So as Lanny explained, the goal here isn't to present results, but rather to just give you a sneak peek of the study design and then to really talk about some of the realities here. So I had the pleasure of working closely with Save the Children and with the Ministry of Health in Somalia to really try to understand a cash plus intervention for prevention of wasting. And we conducted this study in the Bay region and the Haran region in Somalia, really covering diverse populations, including urban, rural, nomadic, and internally displaced people. The intervention was really grounded on a lot of the work that Save the Children have been doing, focused on resourcing families for better nutrition. So this is a model that we wanted to test out in Somalia and answer some key questions on, and this has already been tested in several other regions and was shown to be effective and has a comprehensive SBCC strategy integrated into it. Our main research question here in Somalia was, what is the comparative effectiveness and cost effectiveness of monthly cash transfers alone, cash plus a social behavior change communication, and then cash plus a top up in preventing acute malnutrition among children 66 to 59 months of age and their mothers in a humanitarian setting in Somalia. We had 3 arms. So the first arm received unconditional cash transfers for 6 months. The second arm received unconditional cash transfers plus SBCC for 6 months. And then the third arm received unconditional cash transfers and an additional top-up for 6 months. So we utilized a cluster randomized control trial. We had randomization at the village level. We collected quantitative and qualitative data feeding into our analysis, and we did a cost effectiveness analysis as well, and monitored the markets. So really triangulation of data from multiple sources. Our main finding was that Arm 2, so the combination of cash transfers with SBCC, was the most effective and cost effective in reducing child acute malnutrition as opposed to cash alone. We have several papers that are either in preprint and about to be published. I think that we're dropping in the chat how you can access those. The papers really span from focusing on our methodology to diving into all of the results. We have commentaries as well that have been really led by our collaborating partners and the Ministry of Health in Somalia. So thank you.
Thank you, Shelley. Patricia, are you?
Can you hear me?
Perfect. Go ahead. Yes, great. Go ahead. Thank you.
Perfect. All right. Thanks so much. So I'll be briefly touching base on a study that Save the Children conducted in Northeast Nigeria in response to ongoing supply chain breaks and resulting recurrent stockouts of commercially manufactured nutrition supplements. Save the Children in 2020 began implementing the Tom Brown Targeted Supplementary Feeding Program for the management of moderate acute malnutrition in children 6 to 59 months. Tom Brown uses a locally produced supplementary food in combination with a community-based support group model to treat acute malnutrition. And to build the evidence base around Tom Brown, Save the Children conducted a study in Borno and Yobe states, Nigeria. The interventions in the study included the use of CVA for support group leaders to purchase nutrition commodities at local markets versus the in-kind delivery modality of nutrition commodities to produce the Tom Brown nutrition supplement. Additionally, a community-based support group model was implemented and treatment outcomes were compared using an 8-week versus 10-week enrollment duration. We had 3 main research questions. First one was, which delivery modality is more cost efficient for Tom Brown, CVA or in-kind? Does a 10-week cohort lead to improved nutrition outcomes compared to an 8-week cohort? And lastly, what are the community-based perceptions and experiences of Tom Brown? Our study design used a retrospective cost efficiency analysis, quantitative data analysis of nutrition outcomes using routine program monitoring data, and an analysis of post-distribution monitoring data, focus group discussions, and key informant interviews of enrolled caregivers and lead mothers. Our main study findings were that CVA was found to be twice as cost efficient as the in-kind modality. A 10-week treatment duration led to notably improved recovery and relapse rates compared to an 8-week duration. And there was strong community-wide acceptance of the Tom Brown program with no unintended consequences seen.
Great, thank you very much, Patty. Next slide, please. So our third panelist will be Dr. Justin Kagan. He's the founder and CEO of Kagan's Consulting. He's managed numerous agricultural, social protection, nutrition, and other poverty alleviation projects globally. And he's partnered with WFP for the study that he'll present. Go ahead, Justin.
Great. Hope you can hear me okay. Lonnie, can everyone hear?
We can hear you. Thank you.
Great. Yeah, it's great to be with such great researchers in the nutrition world and to be able to present this. I'm honored. Also to work with WFP has been a real pleasure. They're a great team there. So basically our intervention or WFP's intervention was in Cabo Delgado. It's a northern Mozambique province that's faced a violent insurgency since 2017. Displacement persisted at scale with the two places that we did our research, the two districts in Cabo Delgado, which were Pemba and Montepuez, and they're highlighted there. And it's hosting a significant refugee population, but the intervention also went to some host households as well. And then in October of 2024, during the 6 months where the intervention took place, there was also presidential elections, and there were tensions in the supply food chain, and then a cyclone hit as well, so exacerbating humanitarian needs. Due to funding shortfalls in 2023, WFP was forced to halve the household support initially planned as full ration to sustain the operation. So this is kind of the context for the research. You can go to the next slide. The program settings, basically the target was vulnerable households with children under 2 years. They gave, in these two districts of Montepuez and Pemba, value vouchers for the purchase of nutritious foods, social and behavior change interventions such as cooking schools and radio listening sessions on nutrition, and then market development and livelihood activities, some mobile fresh foods and other seeds and so on that they gave, and then nutritional screening and referral on acute malnutrition. Next slide. So for our research, what we did was we looked at Montepuez, which was a more rural area, and it had a full ration, which was 4,230 mezcal. And then in the other study arm was in Pemba, which is a more urban area. It was kind of a half ration. And then in both of the study arms, they also did both market development, social behavior change, and the nutritional screening. The control group in each of the districts didn't receive any vouchers or the main SBCs like the cooking school and so on, but they could have also heard something on the radio, and they were as well could have done nutritional screening. But most of it was a pure control in both Montepuez and Pemba. So no value voucher and no major SBC. Go on. Our research questions were to compare the outcomes between the voucher recipients plus the SBC, the intervention groups in both of the districts, to the non-recipients, the comparison groups in the districts, and assess the impact of the full versus half rations on acute malnutrition prevention, dietary diversity, food security, and other indicators as well. We used a difference in difference This is a 6 months intervention, as we said. So we did a baseline and end line. We did a difference in difference, and we used inverse propensity score weighting. We have the results now, but have not yet written them up, and they're not yet published. But some interesting developments and some exciting things have come out of it. That's all. Thank you.
Great, thank you, Justin. And finally, we have Andrew Seal. He's an associate professor in international nutrition at University College London Institute for Global Health. He works on nutrition and public health in populations affected by humanitarian emergencies caused by conflict or disasters. And he co-leads the Center for Climate Change, Migration, Conflict, and Health. Go ahead, Andy.
Thanks very much, Lani. So the two studies I wanted to, or be referring today to when we come to the discussion, were both conducted in Somalia in partnership with Concern Worldwide, and both looked at cash and its impact on nutrition or nutrition risk factors in IDPs in the Mogadishu area. So the first one was a non-randomized cluster-controlled trial. And the second one was a bit more complicated when we were trying to look simultaneously at the effect of a cash transfer plus or minus AM health audio messaging intervention. So I can maybe come back to the advantages and disadvantages of trying something a little bit more complicated in these types of settings. But those are the two main studies that we'll be referring to in the discussion. Both were published in PLOS Medicine, if people are interested in results. Thank you. Back to you, Lani.
Great, thank you. So for the rest of our panel discussion here, we're going to be engaged in a discussion about the realities of doing research in complex and challenging environments. We'll have generally two themes of discussion here. So our first theme will be looking at research ambitions and realities. And so some of the general questions we'll be touching upon are about the kinds of disruptions or surprises that were encountered, how the teams were able to adapt in response, and also navigating some of the challenges that they may have found between achieving research goals, programmatic needs, and operational needs. And they'll touch upon how the original expectations may have evolved through the course of the study, and to some extent, what assumptions that were there at the beginning that had to be let go of. And let me first perhaps invite Shelley, and I omitted to give her introduction at the start there. Shelley Walton, she's a senior research associate at the Johns Hopkins Bloomberg School of Public Health. She holds appointments in the Department of International Health, the Center for Human Nutrition, the Institute for International Programs, and the Center for Humanitarian Health. Shelley, what do you think about some of the research ambitions and realities that you encountered?
Right. Well, thank you again. I think that this is just such an important thing to be having a complex conversation on and really sharing these learnings. So I think that there's several things. So I'm going to highlight three of them. So the first really just has to do with funding mismatches between the research grant that we received and then the actual program for which we were embedding that research into. So unfortunately, because of the programmatic realities, we had to compress our study duration from 9 months to 6 months. And this just required really rapid coordination with our donors, with our implementing partners, with our government stakeholders. And so we had to be flexible and agile and well coordinated and communicating heavily on this. So that's the first thing. The second thing that happened that we weren't anticipating and again had to be flexible on is we had to actually shrink our number of clusters that we had originally designed for from 60 down to 33. So this was because of access constraints. So a lot of the clusters where we were intending to do our work were flooded. We had to exclude them. There was displacement. We weren't going to be able to follow our beneficiaries. So this was a reality, again, that required a lot of flexibility and coordination. And then the third thing that happened related again to climate shock. So this, we had flooding again that happened between midline and end line. And there was again displacement. So we had to think through, how are we going to still be able to follow these beneficiaries? How are we still going to be able to ensure that they're receiving the program benefits? So with this, it was a lot of shifting logistics, putting into place these tracking mechanisms so that we were able to follow the displaced households by phone. And so really for us, these three things kind of underscored how we don't plan for a lot of these changes. They're not part of our plan, but really being able to have this adaptive design and thinking through what solutions we might put into place from the start, and having this really strong coordination across all of our partners is so key. So like building relationships, coordinating, being flexible, and being adaptable really made these changes and realities possible for us. Back over to you.
Thank you, Shelley. Justin, what were your experiences and thoughts on some of these questions?
Sure. Well, again, we were in Cabo Delgado. It's a very insecure area, and the original two districts, one of which turned out to be less stable than we thought it was. So then that had to be changed. So Montepuez and Pemba ended up being the places where we did. And the coordination, as Shelley pointed out, a lot of these things is about relationships. And thankfully, WFP has strong relationships with the community on the ground. But nevertheless, as a research team, we also came in with new people. And so we really had to kind of work with WFP to sensitize the community and to be part of that. And in fact, we wish we had done more. That's going a little bit further than this first question, but that sensitization and getting those community leaders on board was so key and so difficult because of the situation, and took a lot longer than we anticipated. But we were flexible and adaptive, as Shelley pointed out, and we had a good team of people, and the donors were good about being flexible as well. And so, but then of course we planned, because there was a presidential election in the middle of it. So we made sure that the distributions were past that time, and we had to be flexible about that. And then of course, aligning the research end line, with the actual distributions, these are always very difficult as well. So maybe we'll talk a little bit about before, some of the solutions we came up with, but this kind of tracking, GPS of the baseline households so that we could follow them at end line, that was very important. This coordination, again, with the data collection team, WFP, the local community leaders, all of those things were really important as well. So some of these things, had to be adapted. We did a WhatsApp group where we sort of were in daily contact with each other, because really things were changing on a daily basis. So the research, as I understood, the research had to really be part of the program, and the program had to be part of the donors, and the donors had to be part of, everyone had to be sort of coordinating with the local leaders. So a lot of moving parts, but having that flexibility, having a lot of plans, even plan A, plan B, and a plan C really, really helped. So those are some things.
Great, that's really good advice, Justin. Just to the panelists, there are some questions coming into this separate Q&A box directed at specific individuals. So if you wouldn't mind dropping in there and having a look, trying to answer some of those questions. Patty, what were some of your experiences and advice that you would have for people?
Yeah, I think one of the realities working in humanitarian nutrition is that it can be really challenging to secure research funds in the humanitarian context. And not just that, but often our program funding cycles are 1 year or often less in duration. So being able to not only secure research funding, but also trying to align it with a often very short program implementation duration can be really challenging. With our Tom Brown program, which fell within a larger multi-purpose cash assistance program, we were unable, as mandated by our donor, to use program funds for quote unquote research, and we were unable to secure outside funds to conduct a formal research trial looking at nutrition outcomes. So what we did to sort of adapt and still try to conduct some sort of a study, given that not just Tom Brown, but different implementation types that are really looking at locally produced nutrition supplements to address supply chain challenges and various contexts globally. There's a real gap in evidence, and so we really wanted to try to address that, and without being able to do that with a controlled trial, we did what we could to build out our meal budget for qualitative and quantitative modalities to inform our programming, including focus group discussions and KAIs, our cost efficiency analysis. We were able to link onto a larger funding mechanism, which conducts cost analysis studies in humanitarian context in order to conduct the cost efficiency analysis. So yeah, I think recognizing that securing funding for research in humanitarian nutrition, it can be really challenging. And so looking at how, as much as we can do within our meal budgets or looking at other sort of funding mechanisms to address these challenges is important.
Great, thanks. And Andy, what are your experiences in this regard?
Yeah, they're very similar, I think. Expect the unexpected. And I remember being in a meeting and we were in the middle of having set up the trial, and suddenly there was real uncertainty about whether there would be enough money to actually provide the cash transfers for this particular study. And I think that's to be expected, because it's very, very seldom that one donor has enough money to fund both the research and the intervention. So that's one of the sort of matchmaking things I think most researchers are trying to do, is to bring those two bits together at the same time, which can be very difficult. So yeah, it's very challenging, but it doesn't necessarily lead to negative outcomes. I remember, for example, following the Rafani Somalia study, which we did with Concern Worldwide, there was an emergency growing. And so the community health worker surveillance system that we'd set up for the study was then adapted to act as a health and nutrition surveillance system in response to that emergency. And Concern and ourselves put resources into that to make that happen. And then that led to a whole sort of new line of work and approach to nutrition and health surveillance in Somalia. So sometimes the unexpected things can lead to good results as well as just to challenges.
Great, thank you. So moving on to our next discussion topic. Next slide, please. So here we're going to focus on reflecting for redesign and providing some advice for doing research in crisis settings or complex environments. And the framing questions that we have for this part of the discussion is asking about what should research teams be building into the design right from the beginning in order to navigate this uncertainty and disruption, knowing that it likely will be an issue. How can we rethink some of the questions around research rigor and balancing that against the realities of doing research in humanitarian settings, while also adhering to and maintaining research credibility. And also, what core advice would you as panelists offer to teams that are trying to balance these research ambitions and operational feasibility? And perhaps let's start with Justin on this one.
Sure. Well, I'm thinking of maybe two key aspects. One is the team building at the beginning, to make sure that you have a team that has worked in a complex environment before, or at least people have, and partner with them. So if there are, for example, our data collection team needed a little more support in these areas, but by coordinating with WFP early, and maybe doing some more sensitization early, they could have trained up in a way. So I think finding the right team, but also training them up to make sure that they're ready for this complex environment, which can produce a lot of unexpected challenges. So that's one. And the second aspect is just from a research perspective. I've always thought that the more is better. We did a large sample. Thankfully, we had the funds to do that, and a large enough, of course, to power our results, but also sort of a large enough sample that if things went badly, we would end up with a sufficient sample size. And thankfully, things did go unexpectedly, but we ended up with a sufficient sample size to power a lot of the results. So, more is better. And I know that funding constraints can limit that, but sort of trying to convey that, especially in quantitative studies, that, sample size is really important and can be affected by difficult settings. Yeah, that's.
Great, thanks, Justin. Patty, would you like to come in on this question?
Yeah, thanks, Lonnie. Yeah, I think for implementers in particular, trying to plan as much ahead during the program proposal and budgeting stage as possible is important, particularly where securing formal research funds is not as possible. Often at the proposal stage, we're thinking more about program implementation activities to plan for, but it's equally as important that we're looking at how we can really generate more data through our programs. And so building out our meal activities and budget at that time is equally important. Yeah, and so think about how much you can do through qualitative and quantitative methods within your program's meal activities and budget during that stage, and work with it. And again, sometimes getting good enough data is better than having no data. As I had already mentioned, solutions using locally produced nutrition supplements to address malnutrition in contexts with significant supply chain disruptions, such as Tom Brown, are growing. There's a real dearth of data on them. And so although our data was not from a controlled trial, we still found it really important to share data from our program to help inform other programs and contexts and local policymakers in this area.
Great, thank you. Andy, what advice would you have for people?
Keep it as simple as possible, number one. The second example I showed when we did this 2x2 factorial trial, it did work and we were successful, but it was very challenging to try and do quite a complex design like that. So as simple as possible is great, maximizes the chances of success, as we have to expect the unexpected. My second bit of advice would be to go to the field. I think it's really difficult for a researcher to understand what's really happening from a long way away. And being on the ground and talking to people, getting as close as you can to what marks the real field is so important, I think, to help put results into context and to to avoid some of the, say, misinterpretations of data that's so easy to do. So you get as close as you can, even if you can't yourself go to the field, at least have a member on your team member of the core research team who is able to actually go and talk to people in the real context. So those would be my two sort of recommendations, suggestions would be keep it as simple as possible, go to the field as much as you can. Thanks.
Great. And Shelley, what would you contribute to this?
Great. So kind of just capitalizing on what some of my colleagues have mentioned. So just to play off on what Andy and I think Justin had both mentioned is about relationships and even going to the field. So just to kind of build on that, one of the huge advantages I think that we had the opportunity to do was to have a kickoff meeting from the start. And this was in person where we brought in our partners, we brought in like key stakeholders, we really co-designed the research and we tried to understand from the start some of these realities. I think what we didn't anticipate though was how important that was going to be in building these relationships. So it made it so that at 2 a.m., my colleague who was in charge of collecting data felt like he could WhatsApp me. I mean, it didn't respond at 2 a.m., but I saw it right away. And so just it built this really strong relationship from the start that I think that if we didn't have that and we didn't understand some of these realities from the start, it would have been a much slower and more challenging process. So that's just to play off on that. I think that colleagues have also mentioned what are the realities with the programming, what are the funding realities? I think that as a community, kind of coming around the table and saying that this is what we can do for this amount of money with this much time is critical. So I think that for donors that are able to fund this type of research, not agreeing to doing something that is just not feasible in 6 months. It's not. Or with only 10% LOE of somebody's time to actually do it. So I think that as a community, we really need to set clear kind of realities and expectations on what we can do to generate really good research given a certain amount of time and given just how much funding is available. So that's the second thing that I would maybe mention. And then just building in, the third thing is just building in this adaptation from the start. And I think Justin said, come up with a plan A, B, and C, be ready to shift timelines, be ready to modify instruments a little bit. And then last thing, Patty had mentioned this, but kind of the tension between waiting for perfect data. I think that there's a lot of really good ways that we can triangulate data. We can do this iterative refinement. Sometimes your data is not going to be exactly perfect, and understanding and acknowledging what is good enough to move forward to make some decisions, especially in humanitarian settings, when having this evidence brought forward in a timely manner is so critical. So that's the last thing here.
Great, thank you very much, Shelley. And just in the 1 minute that we have before we go to the wrap up and conclusion, I was wondering if any of the panelists wanted to speak to the question that Alexa has put in the chat box regarding working with researchers from the country or region and the value in that. Is there anybody that would like to speak to that?
I could just really quick. We worked a lot with the local WFP team, and without their support, we couldn't have done it. So they were the local researchers in a way, and they have a lot of local teams. So I'm very thankful for them. And they were available. This is what Shelley said that was so good, is the WhatsApp and being available on weekends and things. I mean, obviously only when there's sort of crisis and things, but they were, the local researchers were. And so that was very key to helping us get through it.
Anybody else want to jump in before we move on to the conclusion?
Sure. Just to add, I think the local members of the team are usually, well, almost always the most important people, and absolutely critical to try and build that trust and understanding between yourselves before, during, and after the study, to try and make sure you really understand what's going on and they can trust you and you can trust them. It's a huge issue around trust, I think. So trying to develop those relationships, absolutely critical.
Lainey, if it's okay to just add briefly, one of the things that we made sure to also build in, because we really wanted to see this evidence translation and uptake by policymakers in countries. So we also built in this strong kind of collaboration and relationship with the Ministry of Health from the start. And not so much that they were just like joining meetings and consulting on things, but we actually gave their team, they designed and led part of the research. And I think that also made it so that the evidence that we were generating was then going to be even more meaningful for the Ministry of Health. But then there was also this like ownership, I think, that was created as well. And so they really were key stakeholders from start to finish. And now as we're finishing and writing up a commentary, the commentary is partially being led by the Ministry of Health. And they're thinking about how can we integrate this evidence and these findings into our national nutrition policy moving forward. So I think that was something else that goes beyond just our local research partners. It's really like our local kind of policymakers and government stakeholders that are going to be able to move this evidence into action.
Great, thank you very much. So in our last 3 minutes that we have here, can we move to the next slide, please? We'll have Marina Tripaldi, who will summarize this discussion for us. She is also the co-chair of the Global Technical Working Group, CVA for Nutrition Outcomes, and she's a senior CVA technical advisor for Save the Children, and she'll kindly wrap us up here before we move on to the lightning talk. Go ahead, Marina.
Thank you, Lani. It was such an exciting and interesting discussion indeed. What can we say? New gold standards for research are needed. Especially in CVA for nutrition, if we look at the available evidence and what they really tell us and how can we design our programs, how can we implement them, we really need reliable data, and we really need robustness of research and evaluations. But this can be done just if we are able to adapt to changes and, as we heard from all the panelists, really be able to overcome challenges and make this really good balance between achieving a good and reliable evaluation and being ready to adapt to the challenges and all the difficulties that we can have in the field. I can cite some of the examples that were made, really be able to show how relevant is the research and the evidence that we're going to bring on the table to convince donors to mobilize research's funding, which are often very challenging to mobilize in parallel with the program implementation funding. Or other example in scaling down, it can be a geographic location, it can be the number of clusters that we have to reach. So really, I really like the quote from Andy, keep it simple and go to the field. Those are kind of secrets of success. How can we make the program design ready to really accompany our staff in the field to overcome these challenges. And that's why we really think that flexibility is a must. Flexibility in this responsiveness and adaptation, but also in the scale of the research, in adjusting sometimes the goals and objectives, but also in adapting our plan, our initial plan. How can we be flexible in communicating timely with our team colleagues and being able to help them, as we heard from Shelley and from Justin, at really the time that they need. So I think all these examples are examples also of adaptation that can be possible only if we build this strong relationship with the different stakeholders that are involved in our research, relationship with our local research actors, relationship with our research partners, partners that have really the capacity to deliver the research, because sometimes, let's say the truth, we might have a very good implementing a team, but we might not have enough capacities on research. So this partnership really enable the research implementation quickly and efficiently. But also, and most importantly, with our communities and with our local partners to be able to access and quickly adapt if there is an access challenge, to really implement smoothly and swiftly our different research activities. And I really liked the idea of create this team building before the project starts. So invest time in capacity strengthening, invest time in kickoff meeting and all the meetings that we need to have to really trust each other, to really discuss all the possible scenarios that we can incur, that we can, or the different challenges that we can face during our research implementation. It's really like all these series of things, the flexibility, the adaptation, the responsiveness that I think are really my key takeaways from today's discussion. And for the donors, really the idea of allowing flexible funding and allowing the team to have different opportunities, also to change and modify the budget to when there are not allocated funding for research to put in place something that is good enough.
Thank you so much, Marina. That was a great synthesis for this discussion. And thank you, everybody, for joining. And we'll just throw back to the organizing team to start the pre-recorded lightning talk. Thanks, everyone.
Good morning. Good afternoon, everyone. I am Sisai Dammaka from FHI 360. Ethiopian Crisis Response Program. Today, I am going to share you our experience on improving the diet of children 6 to 23 months in an emergency context. Last year, Ethiopia faced one of its worst droughts in recent history. Widespread food insecurity placed young children recovering from severe acute malnutrition at extreme risk. To overcome this problem, FHI 360 launched a targeted response, which is nutrition-focused cash assistance for children 6 to 23 months recently discharged from severe acute malnutrition treatment as cured, with a specific aim to improve the quality of their diets.
This approach focuses on preventing relapse and supporting recovery through improving dietary diversity for targeted children. The program design was unconditional cash transfer to households with children 6 to 23 months post severe acute malnutrition treatment, and implemented across 14 health centers in 8 waradas in Tigray, Somalia, and Amhara region. The key actions and components of the approach were: initially, we operationalized the approach with standard operating procedures that aligned with national and global standards. The SOP covers clear targeting and verification criteria, the value of transfer and its modality, safe and timely disbursement of cash, which is monthly basis and need to the caregivers, and robust post-distribution tracking and regular follow-up. Secondly, we equipped caregivers with basic financial literacy and organized them into mother-to-mother support groups to reinforce nutrition behaviors like appropriate IYCF and locally adapted cooking practices through regular mother-to-mother support group discussion, experience sharing, as well as receiving individual counseling and support at health facility level. The approach blended financial empowerment with practical nutrition support that anchored in behavior change and local engagement. We have observed early promising results. Over the 6 months implementation period, 600 children and their caregivers received monthly cash transfer. There are some cases reported. Improved dietary diversity was consistently reported. Caregivers' knowledge and confidence improved because of the regular mother-to-mother support group discussion, experience sharing, and periodical cooking demonstration. This experience tells us that cash works when nutrition drives the design. Cash transfer can protect the nutritional recovery of children by improving feeding practices when it's tied to behavior change. Combining financial literacy and IYCF support improves the nutrition outcome. Mothers gained confidence and knowledge. Generally, in Ethiopia, this approach is effective and can be transformative. To strengthen and validate these initial results, we are preparing an in-depth evaluation to better understand its impact, operational, the pathway, and potentially for scale-up. FHS 360 will explore how this approach could be replicated or scaled up in another emergency contexts in the future. Thank you very much for listening.
Once again, thanks to say, even though I'm not sure you're still with us, but thanks for that recording. Again. Okay, we know that we have 6 minutes left. So Megan and I have tried to do a very rapid wrap up. There is no way, I'm sure you could agree, to do this artfully and to capture everything. But next slide, please. Nope. No. Oh, have we not? Keep going. Oh, it's the next one. Sorry. It's not.
Sorry, that's all I have.
Sorry, Kate.
Okay.
We must have filled a different version.
Okay.
All right. Just do it verbally.
Yep. I will. I'll start. So we had 5 sessions. The first session was around the global nutrition landscape and nutrition and emergencies through the eyes of a child, which was our guest speaker, Nana. So from Stefano's presentation, we took away, and also from our keynote speakers, that change is coming. Change is coming to the cluster. We know that. We know we're living in a new reality, and many of us have already experienced that change personally. But Stefano's advice was, let's try to lean into the humanitarian reset for greater efficiency. There's no point in resisting it. Clusters are necessary, but they have to evolve to better support national systems. There were a lot of good questions about how you do that, how you support local organizations, and I think people are trying to figure that out. It's been on the agenda for some time, but how we do that effectively, I think we're all still learning. Stefano made it clear that he's going to advocate strongly to keep nutrition central to humanitarian response, and he will resist merging with other clusters such as health, but it remains to be seen what demands are made of the nutrition sector. Nana, then, apologies for the sound, and I know that affected some of the interpretation into English and other languages, but Nana showed us that youth really understand the issues, and she really urged us to consult children and youth to design relevant and impactful nutrition programs, particularly in conflict settings, conflict-affected settings such as DRC. We then had, for those who joined it, an excellent lightning talk from Claire at MSF, who showed that integrating psychosocial support into nutrition programs is possible. And she presented a practical set of tools that have been field tested by ACF and MSF. We then covered strategic objective 1 with session 2 around GNC operations updates. The GNC is clearly adapting to meet new realities by staying responsive, inclusive, and grounded in country-driven priorities, and we're urged to keep that up. And then we had a lightning talk from Alessandro of FHI 360 about the experience of women's access to nutrition services in Yemen, with some positive feedback and some changes made to the program. Then moving on to strategic objective 2 around operation and technical support, we had the working group updates, and you can see there are many groups. Some are a little bit lighter touch than others, but all are open to members, so please join and get in touch. And if you need to remind yourself of who the contact is, get in touch. Take us forward as a life-saving activity. And I think there are several experts that you are, hopefully you can still hear me. Apparently my internet's unstable. And then the last session, the most recent on cash and voucher assistance, we heard a range of positive results from 4 studies with different combinations of cash and social and behavior change promotion, vouchers, and even in-kind input from Tom Brown. And the key takeaways that I took, or that I noted down, was prepare for the unexpected, budget and plan to follow up study participants in the face of floods and displacement, keep research as simple as possible, and don't wait for perfect data. Timeliness is essential to get results out. Build strong relationships and trust with local researchers and communities, and international researchers should get down to the field as much as possible so things make sense. And then try to sync your funding for research with the programs being studied as much as possible. And last, to just say that many resources are available on the GNC web, will be available soon on the GNC website from today and in a report on the event, but get in touch with presenters directly or the GNC help desk if you have any questions. Over to you, Megan, for a highlight of tomorrow's
Thanks,
session.
Kate. Next slide. Okay. So before we close for today, just a preview into what you can expect tomorrow. So we will be continuing under the strategic objective 2 topic, so technical and operational support. Tomorrow will be a very kind of technical focused day. We will have 4 main sessions. The first on MAMI, the second on wasting management, the third on infant feeding and emergencies, and we will be wrapping up the day with nutrition information systems. We will have a similar format tomorrow, so you'll have the option to join networking sessions, different lightning talks throughout the day. before we do close, right on time for today, please do remember to fill out the evaluation for day one. It really helps us to refine this event as we continue. The link is in the chat, and I wish everyone a good day. Take care.